In our 20 years of service, we've come to know these things to be true. Early detection is best. It's your right to know exactly what's wrong. You deserve the chance to right what is wrong. No one has to go it alone. You need a navigator and a roadmap to find the solutions for you. Hope is stronger than fear. Education is more powerful than ignorance. There is strength in partnering with like-minded groups. Local laws are binding. Working all over the country with different people and different mindsets builds strength, allays fear, corrects misinformation, and overcomes helplessness. As co-founders of the Cancer Coalition Philippines, we helped pass the cancer law. So the fight against cancer is every Filipino's fight. After 20 years, we've come to know these things to be true. The army of love, hope, knowledge, and power is always stronger than breast cancer. We are the I Can Serve Foundation, 20 years strong.
Sa pagkakataong madilim, nang tumigil ang mundo, nadama ko ang suporta mo. Sa panahong ikaw ay kinailangan, kumapit ng walang alinlangan. Maraming salamat mula sa amin sa Biomedis, ang inyong sandigan at kasangga. Magkasama tayong lumaban, kaya't magkasamang babangon. Magliliwanag sa bagong pagkakataon. Patuloy tayong magtutulungan at magpapalakas para sa anumang darating na bukas. Tayo ay magkatuwang sa pagbibigay ng mahusay at abot kayang produkto at serbisyo para sa renal care, CKD at kidney stone management, BPH at erectile dysfunction, sa surgical care, pain management at bleeding and trauma, para sa critical care, management ng low-risk to high-risk infections at hypertensive emergencies, at ang bagong kasangga, bitamina para sa immunity boost at vigor. Mula noon hanggang ngayon, ang Biomedis ay naniniwala na isang karangalan ang makapagsilbi at matawag na kakampi ang katulad mo. Ang ating samahan na nag-ugat sa malasakit at alaga. Ikaw at ako magkasamang maghahatid ng lunas at ginhawa. Ikaw at ako magkaagapay na mag-aangat sa kalidad ng kalusugan. Ikaw at ako magkasanggang magbibigay ng alagang subok, mabisa at pinagkakatiwalaan. Kaya't patuloy naming gagalingan at pahahalagahan. Babaguhin at pagbubutihin. Sandigan ng isa't isa mula noon hanggang ngayon. At sa bawat darating na bukas.
Breast cancer. The very words are daunting. A sickness that is not as easy to treat as a common cold or a cough. It will certainly entail a bigger expense. The threat it poses is against life itself. In treating the disease, it is important to prescribe medicines that will improve the quality of life of the patient, giving her hope that springs from giving her a sense of empowerment against the sickness, a feeling of being on top of breast cancer. In treating breast cancer, the choice must be trusted products of quality, the best in healthcare, yet affordable. Trusted quality healthcare products that are affordable. A comprehensive breast cancer portfolio to effectively address the different stages of treatment for your patients. Docetaxel Docetax and Doxorubicin Rubicin to treat the disease with medicines that are a mainstay in the regimen for breast cancer treatment and management. Filgrastim Neosite and Zoledronic acid Osteomet to overcome the complications and side effects and continue treatment for a better quality of life. And Anastrozole Anazole to prolong and sustain life by ensuring a disease and progression-free journey. Choose to be on top in the battle against breast cancer. Choose BioOnco's Breast Cancer Management Solutions.
Di kailanman mapipigilan pagbuhos ng ulan. Ang buhay sadyang ganyan.
At kaya ng papago-bagong pag-ihip ng hangin. Lahat ay lilipas at magsasalita.
Huwag kang mabahala, huwag mataranta. Hindi kailangan ang mag-alinlangan pa.
Isipin mo laging nandito lamang ang aking balikat, sa'yo'y nakaabang.
Asahan mo, hindi ka iiwan sa mundo. Lahat may hangganan, asahan mo. Wala nang atrasan sa iyong bawat hakbang na pumuntahan.
Pangako kailanman, agad akong nandyan.
Tawag mo
At tuwing nagdidilim ang langit, di ba't nagpapakita ang buwan? Hanggang mag-umaga na naman.
Tara't hintayin na natin
Sikat ng iyong araw
hanggang sa magliwanag muli ang lahat. Asahan mo, hindi ka iiwan sa mundo. Lahat may hangganan, asahan mo. Wala nang atrasan sa iyong bawat hakbang na pupuntahan.
Pangako kailanman, agad akong nandyan.
Sang tawag mo asahan mo, hindi ka iiwan sa mundo. Lahat may hangganan, asahan mo. Wala nang atrasan sa iyong bawat hakbang na pupuntahan.
Pangako kailanman, agad akong nandyan.
Sang tawag mo sang tawag mo bayang magiliw, pero sang silanganan, alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyan ka ng magiliw, sa manlulupi, di ka pagsisingil, sa dagat at bundok, sa simoy at sa langit mo bakaw, may nilagang tula at awit sa paglayang minamahal, ang isang ng
Yes, good morning mga breast friends natin na nanonood all over the Philippines, all over the world. Maayong buntag sa inyong lahat. And of course, welcome to Cebu Cancer Chat 2022 with this year's theme, Moving Forward, Moving On. So another year of salo-salo ng mga karunungan at mga new learnings na pwede natin pong i-share sa ating mga loved ones. So, ladies and gentlemen, let's spread the good vibes today. And please, sa mga nanonood po sa FB Live natin sa ating Cancer Experts Philippines FB page, please feel free to share our FB Live this morning. So as I've said a while ago, so ngayong umaga ito, very siksik po yung mga discussions natin. Meron po tayong mga palaro in a little while. And of course, isang grupo ng mga bigating Cebuano talents ang makikita natin mamaya. So, abang-abang lang po kayo dyan, mga ka-breast friends. So, wag na po nating patagalin because at this point, to officially welcome all of us this morning, makakasama po natin ng isang medical oncologist and the PSMO president. Please welcome Dr. Arnold John Uson.
Good morning and a blessed day to everyone. October is the World's Breast Cancer Awareness Month. It is the month where we celebrate breast cancer survivorship as well as to spread information about breast cancer. It is the time that we discuss about the risk, the signs and symptoms, the screening and treatment of breast cancer. Today, as in the past years, the Philippine Society of Medical Oncology, together with the Medical Oncology Group of Cebu, the I Can Serve Foundation Incorporated, the Rotary Club, District 3860, and Cebu Fuente, the Philippine College of Surgeons, the Philippine Society of General Surgeons, and the Philippine Radiologic Oncology Society brings to you the Cebu Pink Cancer Chat, a breast cancer fora. We are fortunate today to have with us esteemed speakers and doctors that will discuss relevant and interesting topic about breast cancer. From breast reconstruction to a more moving topic, coping with a lost friend. We enjoin you to participate in this activity and lay fora, and may we all learn and be enlightened with today's activity. We welcome you all and enjoy the day and keep safe.
Thank you very much, Dr. Uson. Ayun, so narinig niyo po yun. Marami tayong mga matututunan sa umagang ito. Kaya kung meron po kayong mga katanungan, you may write it down para pwede po nating i-share mamaya sa ating open forum. Okay, so mga ka-breast friends, ito talaga ang sunod niyo pong makikita. Isa sa mga dahilan kaya ako po'y nakasama niyo for how many years na sa ating Cancer Chat. Ladies and gentlemen, the I Can Serve Cebu Coordinator, the past District Governor, Rotary International District 3869. Ladies and gentlemen, napakaganda ang aking Ate Mean, Ms. Mary Ann Alcordo Solomon. Good morning, Ate Mean.
Hello, everyone. Welcome to Cebu Pink Cancer Chat 2022, a virtual breast cancer lay forum. Our theme this year is Moving On, Moving Forward. It's very appropriate and it resonates with me. I was diagnosed in 2004. I've moved on, I've moved forward. It's been 18 years since then. For this cancer chat to happen, my thanks to the esteemed speakers in this forum, and of course to the conveners, the Philippine Society of Medical Oncology, the Medical Oncology Group of Cebu, the Philippine College of Surgeons, the Philippine College of General Surgeons, the Philippine Radiation Oncology Society, I Can Serve Cebu, Rotary International District 3860, Rotary Club of Cebu Fuente, with BioOnco Incorporated and Biomedis. We are so happy that we are again gathered to listen and to update ourselves with information about breast cancer and other related topics. In I Can Serve, we empower ourselves with information of what we have and what we can do about it. And this is what we want the general public to know. Breast cancer is the most treatable form of cancer if detected earlier. Our mantra, early detection is the best prevention. Early detection is the cure. Early detection saves lives, and early detection saves money. We want to keep families whole. So please see your doctor today. We want to celebrate life, and do not hesitate. Do not hesitate to see your doctors, because your doctors are your friends. It's usually the fear of the unknown and the fear of being alone that stops one from seeing one's doctor or from having their checkup. Once you have your diagnosis, then you can do something about it. You do not live for yourself. You live for your loved ones. You are not just a victim. The victims are your loved ones. So you don't love yourself. Love your loved ones as well. So live the life to the fullest. Who knows what tomorrow brings? Celebrate life. Happy Pink October.
Thank you very much, Ate Nean. Ayun, let's celebrate life. Napakagandang mensahe na natin. And now, mga ka-breast friends, makakasama natin ang District Governor ng Rotary International District 3869, si Ms. Lilo Alinio. Good morning, Ms. Lilo.
My warm greetings to fellow advocates and colleagues in the Pink Movement, fellow Rotarians of District 3860, our pink cancer survivors we call breast friends, breast cancer awareness supporters and stakeholders, and our participants in the Pink Chat today. A pleasant pink morning. Pink is the beautiful color of the month, one that we remember to celebrate every October as a powerful way to give strength to our advocacy of creating greater awareness for prevention and early detection of breast cancer. I remember I volunteered in the I Can Serve Foundation many years ago, and since then has joined many Pink October activities and events to highlight the important message of early detection is the cure, and dramatize the power of collaboration and building a strong sense of community. Rotary District 3860 started adapting the advocacy when then our past district governor, Mean Solomon, a breast cancer survivor and my BFF, who is very active in the Pink October movement, adopted the Pink October in a Rotary service program in 2016 under our disease prevention and treatment area of focus. Since then, we have not looked back. This year, we once again celebrate Pink October in all areas of Rotary District 3860 in over 15 provinces and islands in Visayas and Mindanao. Pink October will always be part of Rotary District 3860's Days of Service. Fellow Rotarians and fellow advocates, we are moving on and moving forward. Let's get together to take action and change lives as we imagine Rotary fulfilling big dreams for our pink cause. Maayong buntag ninyong tanan.
Daghang kayong salamat, Ms. Lilo Alinio, ug maayong buntag po ninyo diha. Okay, sa lahat po ng mga nanonood sa atin sa ating FB Live Ito na po, magsisimula na po tayo sa ating panel discussion this morning, and I'm pretty sure marami po kayong mga katanungan. So, hinay-hinay, write it down, and you can post your comments or your questions on our chat box, and meron po tayong mga ka-breast friends na magte-take notes so we can like squeeze in all your questions in a little while. So, let's talk about early breast cancer. Do you have a bra? Oh, di ba? Ang ganda ng mga ano niyan, yung mga bra. A breast reconstruction awareness. And makakasama po natin sa umagang ito ang isa napakagandang moderator natin. Isa po siyang Medical Oncology Fellowship Training sa University of Santo Tomas Hospital, a breast cancer preceptorship under the European Society of Medical Oncology, a fellow of Philippine College of Physicians, a diplomate of Philippine Society of Medical Oncology, member of European Society of Medical Oncology, the assistant professor of Cebu Institute of Medicine, medical officer po siya ng Vicente Soto Memorial Medical Center, a visiting consultant ng Chonghua Hospital sa Fuente, Chonghua Hospital Mandaue and Cancer Center, at sa Cebu Velas General Hospital. Isa po siyang medical oncologist. Ladies and gentlemen, ang makakasama po nating moderator si Dr. Jamila De Vera. At ang ating pong mga panelists this morning, ang una po nating panelist is ang Vice President of External Affairs from 2021 to the present ng Philippine Association of Plastic Reconstructive and Aesthetic Surgeons, National Representative to the American Society of Plastic Surgeons, Board of Governors ng PAPRAS from 2021 to the present, Philippine College of Surgeons, diplomate ng Philippine Board of Plastic Surgery, a fellow, Philippine Association of Plastic Reconstructive and Aesthetic Surgeons, fellow, Philippine College of Surgeons, a fellow, American College of Surgeons, an active member of the International Society of Aesthetic Plastic Surgery, international member ng American Society of Plastic Surgeons, international member ng American Craniofacial Cleft Palate Association, a board-certified plastic and reconstructive surgeon, Philippine Board of Plastic Surgery, subspecialty in craniofacial surgery. Ladies and gentlemen, ang una po nating panelist si Dr. Arlene Calao. And ang ating second panelist po, isa po siyang breast surgeon and active consultant sa Chonghua Hospital, a training officer ng Department of Surgery ng Chonghua Hospital Mandaue, member, American Society of Breast Surgeons, member, Philippine Society of Breast Surgeons, fellowship training in breast surgery, KK Women and Children's Hospital in Singapore, residency training sa Department of Surgery ng Chonghua Hospital, Doctor of Medicine, Cebu Institute of Medicine. Ladies and gentlemen, isang breast surgeon si Dr. Aura Lynn Eigo. Magandang umaga po sa inyong lahat.
Hi, good morning, everybody. Sorry for that. It just took a moment to share my slides. I'm Jamie De Vera, and I'm a medical oncologist. That means I'm a medical doctor that treats cancer patients using medicines. Today, in celebration of the start of Pink October, we'll be talking about surgical options for early breast cancer. I will be joined by two surgical experts, and together we'll find out, do you have bra or breast reconstruction awareness, that is? So what you see here is a breast cancer word cloud. It shows all the words that come to mind when you hear the words breast cancer. This clearly demonstrates how overwhelming a breast cancer diagnosis can be. There are just too many things to consider, right? So for this morning, let us, your breast cancer doctors, help you make sense of your breast cancer diagnosis. Fighting breast cancer is a team effort. As you can see here on the left, with the patient as the center of attention, different doctors and allied medical personnel coordinate and discuss your care in order to provide you with the best care possible. Our goal is to make more and more survivors of breast cancer who not only live longer, but live their longest life possible without cancer. Studies show that survival is better when breast cancer is managed by a well-organized multidisciplinary team versus no MDT. If you look at the graph, which represents the survival rates of patients over time, with the solid line above representing patients treated by MDTs, and the dotted line below representing those not managed by MDTs, and at a 5-year mark here, there was a difference of 15% between the two, meaning the survival rates of patients were better by at least 15% at 5 years. And that is really quite a big difference, as evidenced by the wide separation of the curves here on the graph. So in the MDT, this is me. And for today's topic, I will be joined by Dr. Aura Aurego, a breast surgeon, and by Dr. Arlene Calaor, a plastic surgeon. It may come as a surprise for some, but your friendly neighborhood plastic surgeons are not just there for your breast augmentation or facelifts, but are actually responsible for restoring the beauty of your breast after a mastectomy. In fact, Dr. Calaor is the spearheader of the breast cancer Breast Reconstruction Awareness Campaign, or BRA, here in the Philippines. And so, if you don't already have BRA, she will give you BRA this morning, if you know what I mean. So, our topic for this morning is surgery for early breast cancer. In the interest of time, we will only be focusing on early breast cancer, where you can proceed with surgery upfront, which is exclusive of the following cases. Let's ask first to define what is early breast cancer, Dr. Go.
Yes, good morning, everyone. Good morning. Thank you, Jamie. So before we define early breast cancer, I'll just give you an overview of the behavior of breast cancer. So breast cancer, as the name itself, comes from the breast. So from the breast, the first spread of the cancer is towards the lymph nodes. So majority, it goes to the lymph nodes in your armpit. So after that, it will go to the other parts of their body, just like the lungs, the liver, and the bones. So when we say early breast cancer, it means that it only is confined to your breasts. So it has not gone through the lymph nodes or in the other parts of your body. So that is early breast cancer.
I see. Thank you for that, Dr. Go. Can we touch on what is the treatment of early breast cancer?
So when we say treatment of early breast cancer, so we actually have 3 treatment modalities for breast cancer. So you have surgery, you have the systemic treatment, which there are three forms of systemic treatment. You have the hormonal treatment, the chemotherapy, and the targeted treatment. So this, not all patients require the 3. Some would require 1 only, or 2 or 3 at most. So you can have all 3. So your doctor will tell you what systemic treatment do you need. So then the other modality is radiation treatment. So when we say treatment for early breast cancer, definitely you will have the surgery for you will have the surgery, but if when you say systemic treatment, you can either do it after the surgery, so you'll have upfront surgery, then you'll have the systemic treatment after, or there are certain patients wherein they are given, even if it's early, they are given the systemic treatment before the surgery. But majority of these patients will actually go for upfront surgery.
Okay, so when we mentioned earlier about the exceptions to the rule, meaning those that can't undergo upfront surgery, so these patients would need chemotherapy with or without anti-HER2 targeted therapy, and HER2 being something we test for and look for in addition in your biopsy report. So before surgery, when, for example, upfront inoperable breast masses, we have inflammatory breast cancer, wherein the mass is so red and swollen that the borders cannot be defined or measured. And then secondly, we have when there are bulky or matted lymph nodes in the armpit. 3, when there's involvement of lymph nodes above and below the collarbone and behind the breastbone or the sternum. And fourthly, when the mass is either immovable, meaning it is fixed to the chest wall, or it already involves the skin when it is ulcerated or associated with red nodules. And then also when the breast is very edematous with an orange peel appearance. Okay. On the other hand, even when the mass is operable, but number 1, it is HER2 positive or triple negative and more than or equal to 2 cm or node positive. And then we also consider giving the preoperative treatment even if it's just more than equal to or 1 centimeter. Even with negative nodes, we have to consider treatment before surgery if HER2 positive or triple negative. Now, secondly, if you have a very large breast mass relative to the breast size, and then in a patient who desires breast conservation. And thirdly, any node positive disease likely to become node negative with pre-op chemo. And then fourthly, when we have involvement of lymph nodes around the collarbone and breastbone, it's best to give preoperative treatment first. Also, special circumstances such as in the pandemic when definitive surgery would most likely be delayed, then we can also give preoperative systemic treatment. Okay, now talking about adjuvant treatment, these are add-on treatments to surgery. First off is chemotherapy. So just to note that even with early breast cancer, there might be a need for adjuvant or add-on treatments to breast conservation surgery, such as chemotherapy, which is given intravenously. Okay. Secondly, there is radiation therapy. It's a treatment modality using ionizing radiation to kill tumor cells. And therapeutic radiation is delivered by a linear accelerator, such as what you see here. It's a machine that accelerates charged ions in order to, figuratively speaking, burn the tumor. Now, the pic above is a diagram representing how radiation therapy is done, while the picture below depicts an actual breast cancer patient being treated with radiation therapy. And thirdly, hormonal therapy. These are tablets which are taken as maintenance for 5 to 10 years. Now, to move on with our topic of surgery for early breast cancer, let us call in our experts to shed some light on this subject matter. So going back to Dr. Aura, what exactly are the surgical options for early breast cancer?
Okay, so for early breast cancer, we actually have, when we do surgery for breast cancer, we actually, since the first spread of breast cancer is towards the lymph nodes in the armpit, so we actually separate the surgical procedure into breast surgery and the axillary surgery, but we actually do it at the same day, not on a separate time. But we just separate this one just for you to understand what really is the best surgery for you if you are diagnosed with early breast cancer. So for the breast surgery part, you actually have an option whether to remove your breast or to conserve it. So that is what you call the BCT is breast conservation conservation treatment, and mastectomy is we remove the breast. So for the axillary surgery, since this is an early breast cancer, there is actually an additional procedure that we can do to investigate if you already have the cancer in the lymph nodes in the armpit. So the procedure is what you call the sentinel lymph node biopsy. So we actually do it during the surgery, wherein we get those lymph nodes in the armpit that the cancer will go first. So during that surgery, we remove those lymph nodes and we let the pathologist see it, look at it in the microscope, and the pathologist will tell us if there are cancer cells in the lymph nodes. So if there is none, we will leave the rest of the lymph nodes in your armpit. But when you say ALND, that's axillary lymph node dissection, if there's cancer in the lymph nodes that we got first, so we will remove the rest of the lymph nodes so that we will know how many lymph nodes positive in the armpit. So that will tell us what to do after, whether you need the radiation treatment or whether you need the chemotherapy or systemic treatment after, or how long you'll be given the systemic treatment. So that is for breast surgery and axillary surgery. So when we'll go to the breast surgery. So in the next slide, you will see. So this is breast conserving surgery on the left side of your screen. So the principle in breast conserving surgery is we have to make sure that all of the cancer cells are taken out. So we don't just remove the lump, we have to remove its surrounding tissue. So the lump and those around it. So we will be very sure that all of the cancer cells are taken out. So you see here on the left side of your skin, that's a tumor, and the red lines around it that's the part that that the surgeon is going to take out. So that's breast conserving surgery. The requirement for breast conserving surgery is actually after the surgery, you have to do the radiation. The reason for that, because we are leaving you are leaving the remaining breast tissue in your breast. So the radiation therapy will help lower the recurrence so that the cancer will not come back. For total or simple mastectomy, we actually remove all of the breast tissue together with the cancer itself. So there are no breast tissues left behind. So after total mastectomy, you may or may not do radiation treatment after. It depends on the size and the number of lymph nodes that you have, that the cancer, the size of the cancer in the breast and the number of lymph nodes that are positive with the cancer. So that's breast conserving surgery and total mastectomy. So in the next slide, so this is actually an actual patient that is 1 month after the radiation treatment. So you see some discoloration in the skin, but that will actually go away after a few months. So the scar here is in the lower part of her axilla. So that's how we maneuver it so that the breast shape and the breast mount is still intact when we do breast conserving surgery. So for the next slide, we actually have this slide actually shows. I think there's a lag in my. Yeah. So the next slide. So before we go to total mastectomy, these are the contraindication. It means that you cannot do breast conserving surgery if you have this scenario. So absolute and relative contraindications. So when not to do. So if if you're going to do breast conserving surgery, you have to have the radiation 4 weeks after the surgery. So if you're diagnosed with breast cancer during pregnancy, and then we do the surgery, and after 4 weeks you're still pregnant, it means that the radiation is done while you're pregnant, so you cannot do breast conserving surgery. We have to do mastectomy for those cases. So the next one is if there is a diffuse suspicious looking microcalcifications, it means that the disease is actually extensive, that we cannot, it's not possible to conserve the breast. And if we do the surgery, there's deformity, it's not, the breast mound is not there. So there's no use of doing breast conserving surgery if you have, if the breast, there's the aesthetic appearance of your breast is not good. So it would be better to do a mastectomy. So another one, if there's a widespread disease and the cosmetic result is not favorable or not satisfactory, that's one. And then if during the surgery, if after the surgery there's actually an extensive positive margins, even if how much we remove it, so it would be better you do the mastectomy. And of course, if you have this gene mutation, the homozygous for ATM mutation. So relative contraindications, so you may or you may not do breast conserving surgery if you have prior radiation to the breast and chest wall. So we have to consult our friendly radiation oncologist to this. If you have previous radiation treatment before, if you can do another radiation again, they have a requirement for that. If you have an active connective tissue disease involving the skin, like your scleroderma or lupus, because this will actually have complications you actually have complications when we do the radiation treatment. So relative those are yung mga relative contraindications. So for those mga patients na they are high risk, na they have suspected or meron silang high risk to have gene mutation that is predisposed, or yung may mga BRCA, yung tawag nila na BRCA mutation. So these patients should be counseled, because yung mga patients na ito, they actually have higher risk of recurrence if we will do breast conserving surgery sa kanila. Okay, so the next slide is actually ito yung ginagawa natin when we do total mastectomy. So when we do gagawin nating total mastectomy, actually hindi yung tanggalin natin yung breast tapos malaki yung wound natin. So we actually leave skin behind. So the blue line shows where are the things that we should remove. So if we do without reconstruction, tinatanggal na natin yung nipple and areola. But yung mga patients who wanted the reconstruction, which is yung i-discuss ni Dr. Calaor mamaya, they may or they may not leave the nipples. It depends depende yun kung saan yung location ng cancer. If malapit sa nipple, it would be better to remove the nipple itself, or if malayo siya, we can discuss kung pwede i-leave ang nipple or hindi after the reconstruction or before the reconstruction. We do the reconstruction. So ito yung outcome na. So we remove the breast tissue, and ito yung tinatanggal natin, yung walang reconstruction. So you just have a line. So yung wound natin, isang line lang on the area kung saan tinanggal yung breast natin. So this is a very busy slide, pero ito yung mga studies that shows that breast conserving treatment or surgery is actually safe. So makikita natin dito na yung recurrence and then yung survival ng patients who underwent they compare it, breast-conserving surgery and mastectomy. So itong mga studies na to, it actually span for as long as 20 years and nakikita nila there's a little difference in the recurrence. May mga studies sinasabi nila mas malaki yung recurrence rate sa mastectomy, but meron namang mga studies na mas mataas yung recurrence rate with the breast conserving surgery. So the very important thing is that yung survival ng patients, actually there's no difference ng survival ng patients whether you do breast conserving surgery or the mastectomy. The important thing for breast cancer treatment actually right now is not only the surgery, but it's actually the systemic treatment that you need after the surgery or before the surgery. So if you only do the surgery and you don't do the systemic treatment after, hindi mo gagawin yung in-advise ng doktor, then yung survival mo is not as maganda compared sa ginawa natin yung recommended natin na treatment. So surgery is just half of the treatment or maybe 1/3 of the treatment. The important thing is gawin natin yung advice ng doktor natin. So whether we conserve our breast or we do mastectomy, the survival is the same. A little bit difference in the recurrence, but it depends on the pathology. Breast pathology, yun yung ma-determine natin ang difference ng recurrence. So I think that would be all, Dr. Jamie.
Yeah, thank you so much, Doc Au. That was so enlightening. So for patients who undergo mastectomy, so yung mastectomy po, they will be rendered breastless, suso-less, so to speak. So, but wait, there's hope yet, for Dr. Calaor is here. Dr. Arlene, please to enlighten us on what exactly is breast reconstructive surgery.
Okay, good morning, everyone. First, allow me to express my appreciation to the organizers of this event for the opportunity to be part of this movement that has been impacting the lives of many cancer patients. I'm glad to be here and thank you for this chance to share my expertise. So, what is breast reconstruction? Breast reconstruction is a surgical option for post-mastectomy patients, and the goal of this procedure is to restore one or both breasts to near normal shape, appearance, symmetry, and size. Meaning, pag tinanggal yung breast or ang suso, pwedeng i-reconstruct or i-recreate uli ang isa or yung dalawa in order for us to achieve symmetry, meaning magiging pantay siya. Generally, it falls into two categories. One may opt to use implants to recreate a new breast mount or use the patient's own tissue from another part of the body to form a new breast. So, breast reconstruction may require several procedures performed in stages and can either begin at the time of mastectomy or be delayed until a later date. Sinabi nga ni Dr. Aura, pwedeng right after tinanggal yung breast, nandun yung plastic surgeon in order to reconstruct immediately, or the patient can be discharged, can do some rest at home, try to recuperate, and come back for the reconstructive part. So let's talk about implant-based reconstructions. This can either be an expander implant reconstruction or a direct-to-implant reconstruction. The former technique initially makes use of a temporary device, and this is known as the tissue expander. Yung tissue expander, nilalagay yan dun sa may area where the breast was removed so that magkakaroon siya ng pocket, and that pocket will contain the permanent implant later on. So sometimes may tinatawag tayong a cellular dermal matrix that can be used to assist with the reconstruction. So pagka na-expand na, meaning complete na yung expansion, the expander will be exchanged with a permanent implant. On the other hand, meron ding tinatawag na direct to implant approach, and this allows for a breast implant to be placed immediately after mastectomy. That's one will forego the need for a tissue expander. And of course, some patients may still require secondary procedure or touch-ups. So in flap reconstructions, iba-ibang donor sites. So if the donor site comes from the abdomen, it can also come from the back or the buttocks or thighs. So the most common method na ginagamit natin sa tissue reconstruction is the pedicle tram flap. Yung tram meaning transverse rectus abdominis myocutaneous flap. Ang flap na ito kinukuha sa abdomen. So the abdominal muscle, tissue, skin, and the fat are used to create a breast shape. And ang benefit nito sa pasyente natin ay mostly, kaya ito napipili, they have free tummy tuck or a flatter abdomen. And the scar is low, although it extends from hip to hip. This can be hidden by a bikini or your underwear. So the other donor site would be the LD or the latissimus dorsi muscle, and we call that an LD flap. And most commonly, ito siya, kinakailangan niya ng more bulk so that it is usually combined with an implant. As for the other donors, like sa buttocks and from the thighs, kasi nililipat natin yung tissue from the buttocks, which is far from the breast or the chest wall, and also the thigh muscles and not the muscle exactly, it's more of the fats and the skin. Nililipat din natin dun sa area where the breast was removed. This will need more expertise of a microsurgeon. So there are a number of factors that should be taken into consideration when choosing which option is best. And this will include, as mentioned earlier, the type of mastectomy performed by the breast surgeon, the cancer treatment, and of course, the patient's body type. Meaning, you cannot just do an LD flap or you cannot just do a tram flap if you don't have enough tissues to donate. So it is a highly individualized procedure. And if we are considering breast reconstruction, you should do it for yourself and not to fulfill someone else's desire, nor to fit in any sort of ideal image. So para sa sarili, that's what we've been talking about for our survivors. It is a good option for you as a patient if you're able to cope well with your diagnosis and treatment. You do not have additional medical conditions or illnesses that may impair healing, and positive yung outlook mo. And you have a realistic goal for restoring your breast and your self-image. Kaya breast reconstruction is an informed choice. So we can rebuild the breast, and yet the results are highly variable. So ang reconstructed breast, hindi siya magkakaroon ng katulad na sensation before the surgery. And sometimes yung breast that you are expecting is not really the same as you were thinking about. Na. So dapat realistic. Baka gusto mo magkaroon ng napakagandang breast after the mastectomy. Hindi naman yata pwede yon. So there will always be visible lines, and it can be because of the mastectomy. And of course, there are certain surgical techniques that will leave incision lines at the donor site, commonly located in less exposed areas of the body, such as the back, abdomen, or buttocks. So a very important note to all patients, treatment of the breast cancer always comes first, whether or not breast reconstruction is contemplated.
Thank you for clarifying that, Doctora. Can you advise the audience where to look for more info regarding breast recon?
Okay, so the Philippine Association of Plastic, Reconstructive, and Aesthetic Surgeons, in its effort to spread the word about breast reconstruction, has formally launched the Breast Reconstruction Awareness Day. We call it BRA Day Philippines. We started it last year. And we hope to reach more post-mastectomy patients as we continue with the advocacy. So we celebrate BRA Day every 21st of October henceforth. You may check out our website for more information. Can you please show us the website? Next slide, please. Next slide, please. So it's www.papras.org. Just log in and go to questions about breast reconstruction. So thank you very much for this opportunity.
Wow, and that concludes our panel discussion on surgery for early breast cancer. Thank you, Dr. Aure Go and Dr. Arlene Calaor for sharing your time and expertise with us. We hope that by listening to this session, we have all found our BRA, or breast reconstruction awareness.
There you have it, mga ka-breast friends natin dyan, yung ating unang discussion this morning. Maraming salamat po ulit kay Dr. Jamie De Vera, kay Dr. Arlene Calaor, and of course, Dr. Aura Go. Daghan kayong salamat. And I hope marami po kayong mga natutunan sa unang discussion natin this morning. Ayun. Am I live? Live pa po ba ako? Ayun, so there you have it, mga ka-breast friends. And batiin natin yung mga kasama natin dyan sa Facebook Live. Maraming salamat po for tuning in. Ako'y nabubulol. Kape-kape pag may time. Ayun po, so sana po marami po kayong mga na jot down na ng mga notes para pwede po nating itanong mamaya sa ating open forum. Nabubulol ako. Good morning! Ayun, kaya sana po isulat nyo na yung mga katanungan nyo, and pwede nyo po i-share sa ating chat box dyan yung mga tanong nyo, and meron po tayong mga ka-breast friends na umiikot-ikot at ginagather po yung mga tanong nyo po sa umagang ito. Yan, unang discussion lang po natin yan sa umagang ito. And now, sa pinangako ko po kanina, as I promised, it's game time. Kaya tawagin po natin ang ating mga game masters this morning. Let's welcome Dr. Mary Michelle P. Oporto and Dr. Vienna P. Cubillan. Maayong buntag!
Magandang umaga, beautiful people. Good morning, breast friends. Ready na ba for the games and the chance to win very exciting prizes? How's your morning, Doc Mitch? Are you having fun? Are you learning? Learning so much for everyone, but ang dami kong natuto about reconstruction. Do you have bra? Do you have bra? Yeah, and now it's time for just a short game. And you have, just a reminder, you have to be logged in to our Zoom meeting for the chance to participate this game. So let us just share our slides for this game. Ready na? Are you on your laptops or phones? The title of our game is Finish the Lyrics. Yay! For the karaoke masters, singers. Jan, ready na? For the mechanics of this game. Mechanics. So reminder that each participant, you will play as individuals in your own home, and we are going to show the lyrics on the screen. So what you're going to do is you're going to fill in the missing word or phrases. So the first person to type in the Zoom chat, that's why you have to be logged into our Zoom meeting, will guess the missing lyrics, and you have to sing the complete stanza. So he or she must sing the correct lyrics to gain the points. So paano, Doc Mitch, pag yung may off-key konti, ikaw na lang yung kakanta? Pwede din naman, gusto ko yan. ng game masters. But our participants are very talented. I'm sure they're all excited. So let's start now.
All right. So I think we don't need test
test round. So we'll just proceed with round 1. So everybody ready? Parang dami nang nag-ready. Pero please join Zoom so you can be allowed on screen instead of on Facebook. But you can also join at participate kahit sa Facebook. Sige. So the prize pala, we forgot to say, it's from SM, 1,000 gift certificate. So, ready? All right, so round 1. Fill in the missing lyrics. Hindi ko na siya kantahin. Later na. All right, do we have someone already? Baka makanta ko yung lyrics na kailangan i-fill. Hindi ko nakantahin. Ang ganda pa naman ng umaga, masira. Sige, we're waiting. Ooh. Ayan. Floribel Terte. Can you join the Zoom virtual floor and fill in. Hello. Floribel Terte. Yan. So Floribel Terte, can you turn on your video?
Have to sing, Ma'am Floribel. The whole stanza there. Hi po, good morning.
Hi po.
Hi, good morning.
Hi, ma'am. Gusto mo duet tayo, ma'am?
Sige,
Just
ma'am.
kidding. Sige po. Sige po. Let's do this. So, correct yung answer. Alright, so let's sing. Please sing pala, not let's sing together. Alright. Oh, no, nanay. Sige po.
I will survive. Oh, as
Yeah.
long as I know how to love, I know I'll stay alive. I've got all my life to live, and I've got all my love to give. I'll survive. I will survive. Hey, hey.
Ang ganda ng boses. Parang si Gloria Gaynor. Thank you, ma'am. Congratulations. You have 1K gift cert. So we'll just please type in your name and we'll take note of your number so we can contact you po. Okay? All right.
Thank you.
So thank you po. Let's proceed with our next round.
Next. Okay, type in your answers. First to type in the correct answer will get the chance to sing the song and win the exciting prizes. May isa na. May mga, do you believe in Jesus? Do you believe in life after love? And correct answer. First to answer po is Sarina May Manao. Please open your video and you can sing the stanza po.
Hi, ma'am.
Hi.
Hello.
Good morning.
Good morning po. Correct yung answer. So, yeah. You believe in life after love?
Sige, kanta tayo. 1, 2, 3, go.
Do you believe in life after love? Yeah. Come on. I can feel. I really don't think you're strong enough, no. Wow,
Oh my God! Ang ganda ng mga boses.
Parang ang talaga, ma'am.
Hindi na ako kakanta, Dr. Raviena. Ang galing-galing nila.
Parang gusto ko mag-join. Ayun parang maging game master.
Next round. Go.
Type
Yung name and number po ha. Tapos take note namin. Alright, round 3.
Ito. Parang easy to siya. But kailangan with dance. Sige, sino yung type in your answers? Okay lang pag hindi makadancing lang, tapos ako yung sasayaw.
May nag-answer ng Singing the Dancing Queen. Parang hindi yan correct answer. Consider ba to?
Maricar
Salon. Okay, Maricar Salon. Will you please turn on your video?
At they can't turn on pala. Can you sing
pala.
the song?
Okay.
Ma'am Maricar
Right.
Salon.
So, digging the dancing queen is correct. Sige, ma'am. Sing that song.
Ma'am Maricar.
Maricar?
Oh, parang walang signal si Ma'am Maricar, but we can consider that answer correct? Okay.
Hello, Doc. Alright. Hi, ma'am. Ma'am?
Let's
We
hear
can
your
hear you.
beautiful voice, ma'am.
Saan naman yan?
Ay, hindi ko
Hi, Doc. Good morning, Doc.
Okay. Sige po. Sing po. You can dance. Sige.
Alright.
Hello, Doc. Madungog na, Doc.
Yes, ma'am.
Yes,
Oh,
ma'am.
dungog
We can hear you.
kayo. Go, ma'am.
Medyo kayo ang signal dyan.
Sige lang.
Sige lang, ma'am.
We can hear you.
You can dance. You can jive, having the time of your life. Ooh, see that girl, watch that sing, digging the dancing queen.
Very good. Alright. So please type in your number, Ma'am Maricar. You got a 1,000 gift certificate from SM. Alright. So round 4. Mamma Mia.
Here I go again.
How much I love you.
I miss you or I love you?
Okay, first.
Ano yung right answer?
Vanica. Vanica. Jolene. Go. Siya yung first. Hi, Ma'am Janica.
Ma'am Vanica Jolene, go. You got the correct answer. You can sing the song now.
Hello. Hi, Ma'am. All right. Yan.
Okay.
Go.
Okay, go. Mamma Mia, here I go again. My, how can I resist you? Mamma Mia, does it show again? My, just how much I've missed you.
Very good.
Wow, mga singers
Ang ganda
for
ng
there.
boses nila. Diba? Ang ganda. Dapat may girl band na sila. Yung una na lang yung hula.
Yung standards,
Alright,
no?
thank you, Ma'am
Nag-level up.
Van. Please type in your number so we can take note of it, ha? And we will contact you after. Thank you.
And for the last round, one more girl for our girl band.
Pwede din naman, boy, for the
Ito, pwede itong boy.
the
Sige.
number 1 national karaoke song.
And ask me around, and then worst of all. All right, Maybelline, Nano, can you join us, please? Hi, ma'am. You got it right.
Wow, good morning.
Hi, ma'am. Good morning.
So it goes like this. Why do you fill me up, buttercup baby, just to let me down?
Let me down.
And then worst of all, you
Worst
never
of
call
all.
me when you say you will.
Yeah, correct. Very good, Ma.
I need you. Ano man na. Congratulations to all the winners.
Congratulations. So that wraps up our game for today.
Thank you very much for participating.
Please don't forget to type in your numbers and we will contact you thereafter. Thank you.
Ayun, super saya. Maraming salamat sa ating mga game masters, Dr. Mitch and Dr. Vienna, at sa lahat ng mga participants. Congratulations sa mga nanalo. Congratulations. Huwag niyo kalimutan na i-type niyo po yung contact number niyo para sayang din po yung premyo. At mapupunta sa amin yun ni Dr. Bill. Alam namin ni Dr. Bill yung mga kantang yarn, kaya sana pinasali nyo kami. Anyways, moving on sa ating next discussion mga ka-breast friends, I would say medyo sad, but siguro sa discussion natin sa umagang ito, makakapagbigay inspirasyon ang mga makakasama nating mga doktor at mga panelists para po tayo mabigyan ng pag-asa on how we can cope with a loss of a loved one. So moving forward from a loss of a breast friend. And makakasama po natin sa umagang ito ang ating moderator. Isa po siyang medical oncologist. She completed her residency in internal medicine from Chonghua Hospital, Cebu, and fellowship in medical oncology from University of Santo Tomas Hospital. She is affiliated with Chonghua Hospital Mandaue, UC Med, and Allegiant Regional Center in Lapu-Lapu City, and currently the unit head of Chonghua Hospital Mandaue Cancer Survivorship Program. Ladies and gentlemen, Dr. Michelle Cabanesas. And ang ating pong mga panelists this morning sa ating topic na to, una po nating panelist, he completed his residency in family medicine from Silliman University Medical Center, fellowship in hospice, pain, and palliative care in UP-PGH, and he's also affiliated with Chonghua Hospital, Cebu and Mandaue, Cebu, Velez General Hospital, and Vicente Soto Memorial Medical Center. Ladies and gentlemen, we have Dr. Francis Cabatingan. And our next panelist, isa po siyang graduate ng BS Psychology in University of San Carlos, Cebu City, then Master of Arts Counseling, a clinical mental health counseling in City University of Seattle, currently affiliated with Chonghua Hospital Cancer Center Mandaue's Cancer Survivorship Program as counselor. Ladies and gentlemen, we have Miss Elrica D. Michelle po. Maayong buntag sa atong tanan.
Good morning, everybody. Good morning, Ika and Doc Francis. Good morning. And okay, thank you for, we'd like first to express our thanks to all who attended today's webinar through Zoom and through Facebook audiences. No? Magandang umaga po. Good morning, everybody. So, I guess for our topic, because of the big prizes, the games, no, we have like to try to set the mood, no. So we grew up experiencing loss, no. Lumaki tayo, like we lost our front teeth, we lost our toy, we lost our favorite pen, maybe, or maybe our pet died, no, when we were young. So we witnessed death, and death para sa atin, it's normal. We'd like to set that yung reality na we all die. Lahat tayo mamamatay. But I hope in this 20 minutes talk with Ika and Doc Francis, we can give you hope, no? We can give you comfort and give light and maybe give concepts on how to go on moving forward from a loss from your best friend. Okay, Doc Francis. So can we start at first for patients who have been diagnosed of advanced cancer or even end-of-life issues? Maybe we can start from there.
Okay, good morning, everyone. By the way, thank you for this invitation. So basically, because I am a palliative care specialist, so most of my patients are cancer patients, and basically in their advanced stage. So when we say advanced cancer in palliative care, this is already when the patient is being told that cure is already not an option. Okay, so but basically, I would have to define terms because sometimes these terms are being used interchangeably when in fact there's a bit of a difference. And because when we say, for example, advanced cancer, okay, so this is categorized as hospice care. Or cure is already not an option. This is further categorized into two: the end of life and the terminal care. So when we say end of life, but basically the difference between the two is the life expectancy of a patient. So when a patient is being labeled as end of life care, so basically the life expectancy is maybe less than a year, but when a patient is being told that, or if the patient is actively dying, so the patient is on terminal care. So these are important aspects because sometimes patient is being labeled as terminal when in fact they're not actively dying. So our aim is comfort, and hopefully our purpose is improving or maintaining quality of life. So because in this discussion we are talking about coping of a loss of a loved one. So in every encounter with a patient who's been diagnosed to have a life-limiting or life-threatening illness, we should not consider the patient alone, but we have to consider the family, not just the family, the immediate family, but also their friends, their co-workers who are also grieving. So we do not deal with the physical alone, but also we have to deal with emotional, psychosocial, and even spiritual. And also equally important when we are dealing with advanced disease or advanced cancer, we have to talk or we have to discuss about advanced directives or advanced care planning. So because by discussing advanced care planning or advanced directives, this is somewhat so that the patient or the family and family will be prepared. So it's very important, especially if we'll be talking if we will be talking about anticipatory grief, for example. So this is one way of preparing the patient or preparing the family of the eventualities later on. So yan siguro, Doc Mai, to start up the conversation that we have, kailangan nating malaman kung anong advanced cancer. So what we are dealing with, not just the physical, but also the emotional, psychosocial, and even spiritual aspect.
Yes, very true, no? So baka you'll be wondering, the topic is moving forward and we are talking, pinag-uusapan namin dito, wala pa, I mean, dying pa lang. But because we understand that yung we can say grief, yung pagkagool, no, in Bisaya or Tighati or in Tagalog, no, yung grief na yon, usually we have this different types, no? We have the anticipatory grief, we have the grief on the loss, no? So I guess Ika can give us like the counseling or the psychological side of this grief.
Okay. So grief at its core is a natural response to loss. That's why we grieve, because somebody that's important to us has passed away, or any type of big events that are important to us are gone. So emotional suffering, it can be very overwhelming, and then we will experience all kinds of emotions. So sadness, disbelief, guilt, shock. Those are all normal. Normal lang na response to grief. And then the more important gan in ang person, the more intense ang grief na ma-feel nato. Doc Francis briefly mentioned about anticipatory grief. I think in terms of cancer patients, anticipatory grief is the most common grief we will experience because it usually begins at the time of diagnosis. Not only you grieve the possible loss of a human body, but maybe also of a body part, a job, future plans, and whatnot. So one will start to experience grief at that point. To better understand grief, I'll talk a little bit about the stages of grief. The stages of grief are composed of 5 stages. These are 5 stages that doesn't happen in a linear order. It can happen at different times, and you can go from one stage and move forward and then go back to the previous stage. So the first stage is denial and isolation. The denial and isolation, we will always ask, like, ngano nahitabo man ni nako? Like, ngano namatay man ni? Ngano ako man? This is a very common defense mechanism as we begin to process the news and we begin to kind of numb our pain. When we begin to deny, we tend to isolate from us. We tend to isolate ourselves from other people. We don't want to talk about the death of that loved one. So denial and isolation comes together. Next stage is anger. The question we ask ourselves is anger directed towards the person that died. So if she cared for herself more, this wouldn't have happened. She wouldn't have died. Anger is also another masking effect. It's also a defense mechanism of all the emotions we feel during the grieving process. We look at anger as an iceberg. So anger is at the tip of the iceberg, and then below the iceberg are all the intense emotions you feel. So hate, hurt, resentment, guilt, and whatnot. So those are anger that's manifested. That's what people will see. And then we also have to understand that we all express anger in different ways. The third stage is bargaining. So this is the if only stage. Like, if only she called her that night, she wouldn't have died. I would have brought her to the ER. Or if only she got tested earlier, we could have saved her, or she could have lived longer. This is also another defense mechanism, but it also the time that we also question our religion because of the faith that's being thrown toward us, like, why did this person die? But this is also the time that people will also look into their faith and maybe find more meaning towards the loss. The fourth stage is depression. This is the stage that we usually will see among people. This is the more quiet stage of grief. During depression, this is probably when we will feel all kinds of the emotions. This is where we feel foggy, confused, and then this is when we slowly start coping with the loss of the loved one. A lot of people will feel stuck in the depression stage. This is when the outside world will notice that it finally has hit the person who have lost someone. So this is when people will usually come in and try to help you because mas visual man, mas obvious man kung depressed ang tao, walay kaon, walay gana, walay tulog, or kanang nitambok or niniwang or wala ni trabaho. So depression is the more physical stage in terms of grief. And then the final stage of grief is acceptance. Acceptance not necessarily in the happy na manner, but acceptance that we have moved past the grief and then we have learned to live we have learned to live with the loss. Not necessarily forget the person, but we have understand the process now of the grief. You will also at this point understand that life after the loss of the loved one will be different. So once you recognize that, naabot na ta sa acceptance na stage. And then I want to reiterate lang na these 5 stages of grief do not happen linear. It's gonna be a roller coaster ride. So you can go from denial to bargaining to depression to anger and then to isolation again to depression. It's really a journey.
I guess that siguro sa mga myths, no, kanimanggong we try to be, lalo na Filipino culture, no, we like to be always near, kanang duol ra kaita sa atong mga family members. Siguro, I think the most common question is there really a timeline for grief? Ika and Francis, in your cases?
I think I will have to share first. Okay. So basically, in my own opinion, there's, I think, wala yung specific na timeline when a person is experiencing grief, because I think what we have to consider, kung sa jud ako ang i-consider if we are talking about grief or timeline, is the strength of the attachment of a patient to the loved one or to the family member. For example, an older person, kanang dugay na kay sila na minyo. Okay, so for example, 50 years. I think mas mag-uol jud ni siya nga loved one, a bereaved person, as compared to katong bago pa lang nagminyo, etc. So basically, it's not, and also strength of attachment. For example, spouses, when ang husband, for example, the breadwinner of the family, the husband died. So ang wife, mas ang grieving process would be longer as compared to other family members. So that's what we also consider the strength of attachment, or the length of ilang attachment of the patient and of the family members. So there's no specific. It depends on how the bereaved person nga kung saan niya pag-cope. Okay, so I think the strength of attachment is very important when we are dealing with grief. Okay, when we are talking about timeline, etc.
Ika, I guess if there's no timeline, I think, is there a resolution? When do we see a resolution sa grief, no? I mean, the stages of grief, you mentioned it's a roller coaster, but is there such thing as resolution? Yung parang okay na ba? When is okay na?
I think when we say that there's resolution towards grief, is we are able to move forward, knowing that there is loss involved, there is grief, that we process the grief, and then we are able to move back to our daily lives, daily activities, that it isn't interrupting with our daily lives na. So makabalik na tagtrabaho, balik nag-eskwela, or kanang maka move forward like with not much pain, but instead we recognize the love that they left with us, that of the one that has passed away.
Okay, so if this is time, no, is not in our control. So I guess Francis, maybe we can give them like tips on how can we help, no, especially to prepare for the situations, no, and maybe options they can do during this time.
Okay, I'd like to also add, aside from strength of attachment, when we are talking about grief, about the timeline, for example, is what's the cause. If it's an acute for example, motor vehicular accident, cardiac arrest, okay, that's an acute cause of death. So there's a possibility na uban ana nga madugay-dugay jud ang acceptance, for example, as compared to a patient diagnosed of a life-limiting or life-threatening illness like cancer, for example. So there's already an anticipatory or preparatory grief, and if they are already being guided by physicians, by psychologists, then they can move on or move forward easily, maybe. Okay, so there are, based on my readings, there are three kinds of coping. There's a problem-focused, there's an emotion-focused, and there's a meaning-focused coping. So problem-focused, so how do you cope is to solve the problem. Okay, emotion-focused coping is, for example, through emotions by anger, okay, sadness, etc. But one way of, this is just my suggestion, is we have to use the meaning-focused coping. So these, for example, the benefit finding. Okay, so by for example, for this experience that my best friend, also a breast cancer patient, died. Okay, so you have to find meaning about this. Okay, to find benefit about this. What are the positive effect, okay, of this? So I think, and also generating new goals, etc. So by using the mito na to ang meaning focused coping, is we can cultivate a positive emotions. So I think if we get a positive emotion with our coping, I think it would be easier, maybe. Okay, so one way of this is also just my suggestion. One way of doing the meaning focused coping is by doing a gratitude diary, maybe. Okay, so gratitude diary. So what are you thankful for when it comes to this experience? Okay, so for example, I've gained confidence, maybe I gained friends, etc. So I think that would be a positive emotions that you get when you are coping. So hopefully this suggestion, the meaning focus suggestion by doing a gratitude diary or legacy making, maybe, is a good coping mechanism or technique. And I think and also Ma'am Elrica can also add to these.
To echo Dr. Batingan, it's important that we continue to do like a daily of activity life. So physical health is very important at the time of grief. Continue to eat healthy, stay active, exercise, drink water, get enough sleep. It's also important to take care of your mental health. So if you need to talk to somebody, talk to a trusted friend, not a marites next to you, talk to a professional counselor or a professional psychologist. And of course, your doctors are also important members of your team that can help support you during a time of grief. Like with breast cancer, there's a lot of foundations there that offer like support groups. So those are important coping strategies that you can lean on. The internet has support groups also, so just be careful on what you join. You want to be in a safe place when you join online support groups, not in a place that gives you more sadness or more trauma to the death or the grief that you're experiencing. I think one important thing lang to add on in terms of coping is to remind ourselves on those grief triggers, so birthdays, anniversaries, maybe the time of diagnosis, those tend to be heavier days. So when those days are coming up, we might want to be not alone. So have somebody like a family member, a best friend, a breast friend next to you so that you're not alone. And then maybe once we've finished or once you're towards the acceptance stage of grief, we are able to honor them in a nice way. So beautiful foundations, memorials come up during those times when those people have reached the acceptance stage of grief.
Okay. Kaning muhilak ta, no? Di ba? Makita na to, ang mga babae, mas muhilak man sa mga lalaki. Is it true ba na, like, women recover better, mas madali bang mag-grieve yung mga babae kaysa mga lalaki? Or is this grieving the same for everybody?
So that's a very common question we get, no? Mas emotional ko no ang mga babae, grabe mo hilak. We have to go back to the more like physiologic responses of male versus female. So ang mga laki, ang mga men, they like to show what they did in terms of grieving. So they'll say like, oh, nag-biking rako, or they like to do action. So they'll tell you like, oh, I spent more time in the farm, or I like to go play tennis more because I'm grieving, while women tend to express their emotions more. And then when we express, that's when the flooding gates open, so they tend to cry more. Women like to communicate, that's how they express grief, while men like to do it in forms of action and not necessarily talk about the emotional side of grief. So men and women, we just have to be mindful, like we all express grief in a different way and a different manner, and then there's no right or wrong way to experience grief. This is a very individualized experience. So just because we lost the same friend, we will grieve very, very, very differently.
Francis, you can add something?
Yeah, okay. So basically, as physicians also, that we have to let them know the normal manifestations of grief. Okay, so there are the psychological, the social, and the somatic manifestations of grief. Okay, so basically you have to let them understand that these are normal, because if they don't let them understand that these are normal manifestations of grief, so basin og lahi ilang reaction, nganong hilak man ko, etc. When in fact, kaning paghilak is a normal manifestation of grief. So if you won't let, kung dili nimo siya i-allow ang bereaved person to grieve, maybe it will create, for example, like it will lead into a path to grief later on. So as they say, grieving is a pure expression of love. So you have to let them understand that these are normal manifestation, that you have to let them express their emotions, because these are also therapeutic for them. Okay, so either male or female, so you have to let them understand that these are normal manifestations. So, and one of our roles as physicians also is we have to spot maybe, or we have to be critical in assessing who are prone to pathologic grief. Okay, especially if these expression of behaviors, especially this is already an exaggeration of the normal. So we have to be keen on observing this. And later, hopefully we can properly refer these patients or family members who experience complicated or pathologic grief to a professional like a clinical psychologist or a psychiatrist. Okay, so
I guess, okay. Kasi di bang mabuwagan, no? Tendency, panglaban ni mo tanang gamit. mura ba og kanang out of sight, out of mind. Is this the same also kaning mag-grieve ta kanang ipangkipos na nilang gamit, kanang mura ba og i-erase na siya sa imuhang memory? Is this one good way of coping for grief?
That's like when we grieve, when we say moving forward, yes, one of it is maybe we have slowly accepted that the person we love has passed away, we have lost them. One way of showing that we have accepted this loss is when we slowly pack up their things. Not everything, but we try to keep pieces that are integral, that are important to us. Just because we accepted the loss does not mean that we're forgetting about that person. But when we move forward, wala na nato sila nakalimtan. We will still try to honor them on their birthdays or on days that we feel like they're important to us, and then they'll just come to us when we have triggers again. This will help us. We will be able to not feel so much sadness, but instead be able to kanang feel the love that they left us na instead of the sadness.
Okay. And I guess experience ni Doc Francis, no, daghan man sila sa mga projects in PGH, no, they have this bereavement care program, and I hope, no, this is something we ginahan me na will be part, no, of our services also. So Doc Francis, maybe you can share to them about a bereavement care program.
Okay, so as what I mentioned, we do not stop when the patient passes away. We continue until bereavement. So we have to continually contact family members, especially, ideally bereavement care should start even though the patient still is alive. Okay, so that we can properly assess who are really prone to a pathologic grief. For example, if this family member is very close to the patient, etc., so we have to continually assess this patient. Maybe this patient, after the passing of a loved one, of the mother or the father, this patient will, or a candidate of a pathologic or complicated grief. So bereavement care, we continue after the passing of a patient or of a loved one. So basically, what we do as part of bereavement care, so we offer condolences. Sometimes we send cards to the family, and sometimes we go to the wake of the deceased loved one of the family. So bereavement care program, usually we will follow through with the family up to a year. It depends depende sa pag-cope sa family member. Okay, so in PGH during my fellowship training, in usually October, first week of October, a hospice, palliative and hospice day, we conduct bereavement care program. So usually, first we start with a mass, then we invite family members, by the way, whose loved ones passed away, mga namatsan. Okay, so during the bereavement care program, after the mass, we have a talk about death and dying, and after the talk, NAMI gathering. So a small group gathering, we have to let the family member express, okay, how they cope, etc., because it's also therapeutic for them, and also therapeutic for the rest sa ubang mga family members, so that they will know how they are coping. So bereavement care program, so it's not just one day event, so we continually contact family members. So basically, constant communication with the family members is very crucial in bereavement care. And if upon assessment, for example, kaning family members, for example, the eldest or the financial provider is very sad, for example, so we provide counseling. or we do not hesitate to refer that family member to a professional help. Okay, so we continually, sometimes we contact them every week, etc. for as long as there's a need, okay, to communicate with them. Okay, so sometimes also during, for example, All Souls Day, All Saints Day, in one of the Madre de Amor Hospice, All Souls, or the All Saints Day. So sometimes mag-visita iglesia. Okay, so that's one way of doing bereavement care for them. Okay, so those are the programs, and hopefully we can also do that here in Cebu.
I think that would be very timely, no, with the support groups I can serve. No, that's a program you can set up, no, a bereavement care, or a group that will be in charge, no, on taking care of your members, no, because of course the anxiety, like Miss Ika have said, that indeed, no, the death of a breast friend, no, can trigger kanabang murag kuyawan na pud ang uban, no. So very common yun na concern. So I guess that would be a very good program. Also, I guess kanang common question siguro pangutano nila is na by right words to say, Ika, no, kanabang kanang naay mamatsa, no, mura baka og lost for words to say. Are there right words to say to bereaved family?
I think when we talk about grief, no, people feel awkward just talking about the death of someone we love. I think it's important that we will acknowledge the awkward yun siya to talk about somebody, especially if we're not so close with them, but we want to be able to be of support. So sometimes it's easier to just be there if you're somebody that you're a trusted friend, a trusted best friend. Having somebody having you sit beside somebody that's grieving a loss is already a very huge help. Sometimes also we like to be very helpful. Like, what can I do? What can I do? Akong matabang. And sometimes the person who is grieving, foggy na iyang brain, dili siya ka-think straight, dili sa siya katubag nimo og tarong, like unsa gyud ihang kailangan. So sometimes it's easier to be more direct, like, oh, hatdan ti ka og dinner ugma. Like, ayaw nag-worry, ayaw nagluto, ako na bahala. And then somebody else will offer, ako na pick up sa imong kids the entire week, ayaw na kaguol, ana. So those are more direct ways to help somebody who is grieving, more practical things. I'll pick up your groceries, and I'll take care of the flowers, I'll take care of the mass or whatever, and so when we want to be helpful, sometimes we just don't know the right ways to be helpful. So being more specific, more direct, or maybe ikaw ba ang point person sa tao na daghan kay calls, like this grieved person has a cell phone that keeps on ringing. You can be that person in charge of that cell phone. Ikaw ra mo tubag, I'm sorry, she cannot take your call right now. She's going through a lot. Ikaw lang mo receive. And then if pangsuwat ka na, hindi mo tanan ang nag-call. And then it's up to the person na later to get back when she is ready, or when she is ready to talk to the person na.
Okay, no? So I guess murag na tubag na namo siguro inyong mga questions, but if you have more questions, no, we are very open, because our topic would like to be it a more maybe personal for you, and maybe we can help. So may I call on now Dr. Elimay Villegas to help us with the open forum, because maybe we have questions from the floor.
Thank you, Dr. May. Okay, pata, gigutom na mo. So, salamat kay sa tanan natong audience. We are almost 200 in the virtual floor. I think 60 sa Facebook. Unya murag mga 130 kapin here on Zoom. So, pasalamat ko sa tanan nga audience o sa tanang speakers and panelists. So now we will open the floor, the virtual floor, for the open forum. But actually, an iPhone in question, ganiha. So I saw that in the audience, we also have our radiation oncologist, Dr. Gigi Chua. G, are you still there? So naipangutana, why is radiation therapy needed if mag-BCS or breast
conserving surgery and what to expect during radiation. Siguro yung pangutana, hadlok ba na siya, unsa kadugay, how long ang radiation, sakit ba na? So maybe Dr. Gigi Chua can, the digital team can open the video of Dr. Chua, please. Miss Melay, is Dr. Gigi Chua here? So while we are waiting for her, I can... She's not in the environment ba? How come I see her name? It's okay. So, katong first panelist, it was all about early breast cancer. Is she here, Miss Melay, already? G, are you there? Okay, so I will get back to the radiation question, ha? So, Dr. Arlene Calaor.
Yes, Doctor.
Kani bang mga patients nga magpa-breast reconstruction, sometimes they have so many expectations. How do you manage them? Kaya kasi ganahan ni silang ma-artista, ikaw man nila reconstruct.
Okay, that is always the challenge, no? When we talk to patients who want to undergo breast reconstruction, it is always important to manage the expectations. Meaning, atugod sina sultihan, unsay may tabo after the reconstruction. We have to differentiate what is reconstruction and what is aesthetic enhancement. Okay, usually, when they learn that the one managing them is a plastic surgeon, they would expect na mura bitaw na ilang boobs when we say no, magwapa na, marag artista, pwede na sila mag-bold star. No, actually, that is not the point. The point is, if when we talk about reconstruction, we deal with a defective breast because of the mastectomy, and we want to put it back or recreate a mound that is near normal. I keep on emphasizing the word near normal because we can never be able to recreate exactly what was or how was the breast before the surgery. So, ang difference ana is that kung aesthetics gani, nindot naman na sa breast. The problem there is, no, it's not really a problem, but the thing is, we're trying to manage someone's expectations during that time na ganahan sila nga manindot pa jud ang normal na gani nga breast. But when we talk about reconstruction, we just want to somehow put it back. So it is important to communicate with the patient na there are also risks. Now, after the reconstruction, it's not always perfect. You may lose the sensation. You may not have perfect symmetry. But somehow, doing the reconstruction will always give you a better quality of life, and you will have a better image or a self-image. Thank you, Doctora.
Thank you, Dr. Calaor. So we go back to Dr. Gigi Chua. Can you open your video, G? There was a question, why is radiation therapy needed if breast conserving surgery, and what to expect? Yeah, you can unmute also, G. Please unmute, G. We can unmute Dr. Chua, no? Can you unmute Dr. Chua? We cannot unmute her. G, you have to unmute yourself. G, can you unmute yourself? G, kindly unmute. These are the realities of live programming. Virtual pa man din. G, i-unmute mo. You're showing your age, ha? Unmute. We cannot hear you. We will get back to Dr. Chua. Somebody has to call her. Dr. Arnold Uson, kindly call Dr. Chua because I think she's using her phone. It's very small, and you know, our eyesight is giving up. There's also a type-in question. So first, I'll go to our breast surgeon. If the diagnosis is DCS, ductal carcinoma in situ, is mastectomy recommended, Dr. Aurago? And segue, if you had breast conserving surgery, wa ka nagpa-mastectomy, breast conserving surgery, and then there is recurrence, what to do? So there's actually 2 questions for Dr. Aurago. Go ahead, Al.
Okay, thank you, Dr. Villegas. So for DCIS, you can still do breast conserving surgery for DCIS as long as this is a mass forming DCIS. It means that the calcification and the tumor is actually we can remove everything. So there are DCIS that are actually very extensive. So like a lot of segments or a lot of quadrants, or 2 quadrants or 3 quadrants that is involved, so that the suspicious microcalcifications are spread to majority of the breast. So if we remove all those things and we are only left with a little breast, and then we cannot, even how much we do local flap reconstruction in that area, the cosmetic outcome is hindi siya maganda, not favorable. So it would be better to have a mastectomy. But your doctor, your surgeon will actually tell you if it is feasible to do breast conserving surgery for DCIS. And for the second question, actually, if you have recurrence, so kasi buhato na to if you have recurrence. So if you have recurrence, kasi before, if you have recurrence for breast conserving surgery, you have to do the mastectomy. The option for you is to do mastectomy na. But there have been cases wherein you can actually do breast conserving surgery again if you want to, and that's the relative contraindication that I mentioned earlier. If you have the recent or there is breast irradiation that was performed, there's actually, maybe Dr. Chua can enlighten us on that. The gap between the radiation treatment to the previous diagnosis to the present diagnosis. So it depends. It depends on the situation. But a lot of patients, actually, if they have recurrence, they wanted to do the mastectomy. So that's the time we can do the mastectomy, if you have.
Thank you very much, Dr. Arago. I beg for your indulgence because we're supposed to stop at 12 noon, but overwhelming ang response ato ang namata na ang ato ang mga audience. Daghan na magkaini sila ko ano Daghan na magkaini sila question. Mo end naman unta ta, pero sige lang. Okay ra magka ninyo nga mag-extend ta hantod gabi hangtod 12:20 or 12:30. So we are now ready for our radiation oncologist. She is the radiation oncologist at Perpetual Succor Hospital, Cebu Cancer Institute. Dr. Gigi Chua, please. Kaya na, ma-unmute na. Di gihapon, G. We will go back to you. And Dr. Bill Ramos is phoning in a question. This question is actually directed to Ms. Elrica Go. Grieving is a natural process, Ika. But kung matangtangan kag tutoy, is it natural also to grieve over the tutoy? Is it okay to grieve after mastectomy?
Yes, Doc. Like, it is okay to grieve the loss of a breast. We are grieving for the experiences, for the possibilities, or the imagined future that we have with these breasts. As women, it really means a lot to us. It's an identity. especially if we're single, like how do we find a boyfriend, if we will get married, and so that's a possible loss in the future. So it is okay to grieve. It's not as common as grieving like in terms of like a leg or an arm, like because it has more function per se because it's used for walking, but also like with breasts, it is a loss of a body part. So it is okay to grieve, and we should be able to normalize being able to grieve even a very small body part. So yes, Doc, okay ra gid kaayo to grieve for the loss of a breast, and we should not shun, or we should not embarrass or shame the person for grieving a loss of a body part.
Thank you, Ika.
Thank you.
And then there are also questions from our I Can Serve breast cancer survivors, from Ms. Sharon Rodriguez. I think Dr. Jamie De Vera or Dr. Maymay Cabañasas or Dr. Arnold Uson may answer this. Is glutathione injection safe for cancer patients or cancer survivors? Not also to say nga safe na siya if non-cancer patient, ha? But I want to hear their replies. Jamie or Arnold or Maymay?
Sorry, I'll take that question, Doc. So glutathione, in order to say something is safe or unsafe, there has to be several studies done to actually document what can possibly happen with regard to side effects and such. So we cannot absolutely say 100% that this is safe or unsafe. But if it's something that you need, and but what is the indication for the glutathione in the first place? Pampaputi lang ba? Can we do without it, or are you taking it for detox? And is there no other way for you to detox? But if you still want to pursue that, I think the best recourse would be to do it after all your treatments are done. You're not receiving anything else intravenously, in order that there would be no interactions between the two. But glutathione is a normally occurring chemical in our body. But of course, we can't predict if we are giving it externally, no? Meaning more than the usual amount that our body produces. So I hope that answers your question.
Yes. Do you want to add more, Mai?
I guess what matters is like the dose, like Doc Jamie have said, no, and what it's for. So for me, in my practice, when patient ask, I have to ask them what's for. No, same recommendations with Doc Jamie. If you want to have it as detox or as part of your cleansing, because some would have really recommended it for cleansing. So I would advise them to have it after when all their treatment have done. That's all.
Okay, thank you very much, Mai. There's another question in the Q&A box. Is osteoporosis avoidable after going through chemo? So, Seniority na gyud ni our president of the PSMO can actually answer this. Or the one beside him, Dr. Noemi Uy.
You have to emphasize the seniority.
Correct.
Anyway, thank you for that question. When you do on chemotherapy, especially when after that, you will also, yung karamihan sa mga breast cancer, lalo na yung mga hormone-sensitive breast cancer, hormone-positive, they are given a hormonal treatment is practically to decrease the estrogen level of those patients, because yung mga pasyente na to, meron tayong, the hormones are the ones that are actually part of the stimulation of the tumors, no? So pag binabreak mo yan, you know that estrogen, and pag nag-menopause na yung babae, bumababa yung estrogen. So it is also, in a sense, prone sila sa osteoporosis. So itong mga pasyente na to, usually tinitingnan namin kung meron silang osteopenia. So minsan probably the doctor will ask you to have bone mineral densitometry, no, BMD, no. So ito yung tinitingnan natin kung ano yung bone, no, density. And then dito makikita natin kung osteopenic na siya at saka patients that are prone. So yung lalo na yung hormone. What we do is actually give bone remodeling agents. No? Pwede ito yung mga tinatawag natin. It can be injectable in a sense and pwede rin naman subcutaneous, yung injection lang. So yes, pwede ma-prevent ito. And then you just ask your oncologist about it or your doctor about it. And then aside from that, we also supplement with calcium, no? With vitamin D. So yes, it is preventable and it is something that we have to treat because it is also a problem later on, lalo na yung mga bone fractures, no? So nape-prevent naman. Thank you.
Thank you, Dr. Uson. And there's also a question whether breast reconstruction may be done later, as in later 4 years after the mastectomy. So nakarealize siguro si ma'am nga, trying to shine. Ganahan ako magpatutoy. Then what? Nawalan siya tutoy. I think nag-mastectomy siya. Dr. Calaor?
Yes, okay. As mentioned earlier, breast reconstruction can be immediate, meaning right after the mastectomy is performed by your breast surgeon. And the other one is a delayed reconstruction. So delayed reconstruction, even up to 4 years after the surgery, can still be done. Somehow, at this point in time, it's just a bit of a challenging time for the reconstructive surgeon because at this point, if the patient has underwent, kung nakaagi ka radiation, kung nakay other treatments nga maka-apekto sa imong skin, that can be a challenge. Pero there are a lot of ways to address this. So pwede man butangan sa usa ka og implant, an expander para mo expand to ang pocket that should have been there but was not created kay during the mastectomy you did not think about reconstruction. So once the pocket again has been formed and it can already accommodate the implant that can be placed on that pocket, pwede na ka ma-reconstruct. And the other thing is, you can also make use of your own tissue, just like what I mentioned earlier in a flap reconstruction. So the answer is yes, you can still undergo breast reconstruction after 4 years. So don't feel sad about it. May hope pa jud. And you can fly high.
Wow. So there's always sunshine at the end of the storm,
yes.
Dr. Calaor. Daasay mga pangutana for Dr. Francis Kabatingan. When you do your kanabitong, how do you say that, Franz? Kanang magkuan bitaw ka, if you are doing home care, ang pasyente wala sa ospital, and then you are trying to discuss regarding advance directives, mga living will, unsay mga pamaagi o mga preparasyon, magpatabang ba ng pasyente, kung mubati na siya, kinahanglan ba na papirmahon ang pasyente?
Okay. Thank you for that question, though. So basically, when we will be discussing advanced care planning or advanced directives, not necessarily na kinahanglan papirmahon jud ang pasyente, nga naa jud tay notarized jud with a lawyer kung unsa ang decision sa pasyente, as long as there's an agreement that you discuss this thoroughly and also there's a witness about what's the wishes of the patient. There's no need, okay? There's no need to let the patient sign. Okay? But kana, as long as you have to respect kung unsay gisulti sa pasyente nga this is what I want, if ever mubati ko, di na ako magpadala sa hospital, di na ako magpa-chemo, di na ako magpa-intubate, etc. Even though it's not written, as long as there's a witness, ideally, it should be discussed with the rest of the family. So it should be a shared decision making. So that, for example, kung because there's it's not a need that papirmahon jud ang pasyente, so at least daghan kay makadungog nga mao jud ni ang wishes and we have to respect. So it's not necessarily nga kinahanglan mo pirma jud. Sometimes gani ingon sila nga pwede ra verbal, okay? It's not really needed nga it's in written form nga maoni akong wishes, etc. As long as maoni gi-express sa pasyente, we have to respect. Okay, so
Thank you so much, Dr. Francis Kabatingan. And then, naipangutana, ako na lang mo tubag sa daan para madali. So, kinahanglan ba kuno ang mga supplements i-continue? Kaning calcium o vitamin D, kita ra ba di ta manginom og calcium o vitamin D itong bata pa? Nya karon gors na diha na magdali-dali. So, kasagaran asya no, we're very prone to osteoporosis. Mas maayog yung naatay calcium o vitamin D, whether from natural sources, sa imong pagkaon, or kung di sa kahilig mag dairy products, pwede ra sa ka mo inom og supplements. With regards to supplements, ako na lang ning i-appeal, walay supplement nga makaayo sa cancer. So those are only complementary drugs ha. Dili na siya ingon nga kanang mag-alternative medicine na lang ko do kay maayo ko. So kanang alternative, dili na siya medicine. Alternative therapy siguro, not necessarily medicine. Nawa ako ang kuan na ghost ko kadiyot di ay. So, ang ato na lang ning tawagon Dr. Aura Go siguro. I know nga lain-lain o presyo ang kanang mga surgery, pero can you give a ballpark figure out how much to prepare for the surgery? Mastectomy, and I guess that question also goes to Dr. Calaor for reconstruction.
I'm sorry.
So, murag makasab-an taani kay depende ni sa tulingon din hi basin kasab-an taani din hi inig human ni manawag nako ngano inana ra imong giingon. Actually depende gyud. So, mingon tag kanang siguro hospital cost.
Di ka tubag.
Maraming kunatangtay, no? So, ingon tag hospital cost manggod, it depends on the length of surgery. It depends on the kanang all the things that say gamito nato inig surgery, no? So magdepende gyud na siya. It will actually vary, and unsa nga type of surgery mo ha, kung mastectomy ta, if you want katong nice sentinel lymph node biopsy, you might have kanang additional cost niya. So siguro I would lisod kaayo, no, kay vary kay ang patient. So some mga so mga
talk to the ato lang mo magsabot sa clinic, in other words.
Exactly. Lahi mong good siya. It depends good sa kuan. And then lahi mong good if I say the amount here and then musubra imong bill sa hospital, paninglan ta uy ingon to si kuan kay adto na lang ko adto niya kay niingon siya. Dili na siya mo na makasab-an ta, so dili na you go ask your doctor. Pwede ra gyud ta mo adto ha. If you adto mo sa lain, you can go to a lot of doctors before you actually proceed. So depende na siya sa ato ang procedure, and there are a lot of factors to consider. But okay, I hope you're not discouraged to have your mastectomy done. Thank you.
Dr. Arlene, safe?
Yeah, okay. Thank you, Dr. Aura, for answering that question. Anyway, sa plastic reconstructive surgery naman, it's the same, no? It depends on the amount of work that has been done in order to reconstruct. Okay, as mentioned earlier, we can do in stages or we can do one time. So there will always be different procedures that will actually make that breast mound or that recreated breast look near normal. So dili na siya kausabuhaton. So ang presyo ani lahi-lahi pod. And of course, if you use implants, samot na, no? Because in the Philippines, we still have this problem that the implants are still not covered by insurance companies, unlike in other countries na breast reconstruction has been there for a time, and they've worked on some insurance companies that when you use breast implants, it is covered. Hopefully, PhilHealth will hear what I'm talking about here, no? Because breast implants are a bit expensive and pricey. So again, if you want to know the price, we don't disclose it here because we want to talk to you, because again, it's a unique experience of every patient. So kung pila iya sa usa, lahi pod ng imo, dili mo parehas. Okay, as we always say, it is tailored to what is necessary and what is fitting and what is best for you. So kung okay ni Juan, dili pwede ni Juana, dili pwede ni Juanita, no? Lahi pud. Okay? So I think that's all I can say regarding pricing. Thank you.
Thank you very much to our surgeons. Grabe kataas sa ilahang mga kuan. Ang bottom line, dili man ni parlor nga pareho ra ang shampoo ug ang pag-conditioner, ang pagpuputol sa buhok na ay long na ay short, ibutang ra dito ang poster sa gawas. Mao bitaw nang dili ta mo advertise og tambal. Ang naay gi-advertise nga tambal sa atong TV, katurang over the counter. Pero kaning ato ang mga panagtambal, dili gini pwede ibutang sa advertisement. Ang gibutang sa advertisement, katong mga tambal nga gibutangan og no approved therapeutic claim. So dili sila tambal. Kung magpatambal mo, adto mo sa tambalanan. And then, I think this is time na for Dr. Chua to answer our question. Are you able to unmute yourself, Dr. Chua? Pwede na. Ana pa giayo ko no.
Grabe
dili
pa.
Grabe gyud ang struggle bitaw aning virtual. So anyway, we can go back to Dr. Chua after me. Last word siguro, one sentence from each of our earlier speakers. So may I start with the first panel in order of Dr. Aura Go, Dr. Jamie De Vera, and Dr. Arlene Calaor. Go ahead.
So when siguro we'll talk about the early breast cancer treatment. So early breast cancer treatment is if you are ang atuang kuan ani is unsa man jud atua i-conserve or not to conserve, no. So a lot of factors ang atong i-consider, and it is not only maybe especially katong mga married couples, it's not only siguro your decision. I always tell my patients na ask your partner if he's okay or not. Kay there might be strained relationships after if you want, like may uban ganahan jud kaayo ang patient and the husband doesn't want to, and then there'll be strained relationships after the procedure. So very important thing is shared decision making sa family, and ang important also is the support of the family sa patient. That's very important for the treatment, the whole course of the treatment. I think that would be all, Dr. Liegas.
Dr. Jamie De Vera.
Okay, everyone, since we're talking about early breast cancer, to know if you have early breast cancer, it's best to get screened. And this is the purpose of Pink October, to promote this breast cancer awareness. So every October, mammograms and breast ultrasounds are available for screening. You can get this done as soon as you're 40 years old and female, and you have this done every year. And every October, this is 30% off in all hospitals, diagnostic centers, in government hospitals. This is absolutely free. So please get checked. Thank you.
Dr. Arlene Calaor.
Okay, breast reconstruction is an informed decision, and treatment of breast cancer also requires or will also be more complete if there is breast reconstruction. It does not end with just the mastectomy and oncologic treatments. But it is very important to note for all patients that treatment of breast cancer always comes first before reconstruction. Whether you decide on reconstruction or you decide not to undergo reconstruction, make sure that the breast cancer is treated first. That's the most, and that's the priority that has to be given attention to. And let us close the loop. That breast cancer ribbon has to be closed, and that's where BRA, or breast reconstruction awareness, comes in. Thank you.
Oh, very well said to our pretty panelists for early breast. So, dili tanan kinahanglan magmastectomy. Pwedeng magmastectomy, pero kung ganahan mo, pwede rasad mag-breast conserving surgery. Speaking of breast conserving surgery, kinahanglan na ay radiation after. I'm speaking for the radiation oncologist na mention na po ni ganiha. Ang kanang pagpa-radiation, di na siya sakit. So, di na siya sakit. Usually, kung sa breast, ang adjuvant treatment 30 days. 5 to 10 minutes ra ang procedure mismo, and then dili ka radioactive. Actually, kung mugawas na ka sa room dito sa radiation, because the wall is very thick, when you go out, you're not radioactive anymore. Kay dili man na katong tunlo na to, kinahanglan kay isolate. And this is very affordable because PhilHealth already put in place kanang mga discounts. But I don't know if our radiation oncologists can already peek in, G, at this point.
Yes.
Yes, Yay!
Finally!
All right, G, go ahead. Thank you.
Okay, as you have mentioned, no? So affordable ang radiation therapy, and you are not radioactive. So pwede kang umuwi, pwede kang padoon sa mga bata, wala ray kaso. This is more of an inconvenience because you have to go to the hospital every day for 30 days. But it's not painful. You will not feel anything during the radiation, except for the, of course, mga skin changes like that.
So, ang skin changes, ang side effects, Dr. Chua, they are very tolerable.
Will be redness initially, and then later on, pwedeng may minor burn, like 3rd-degree burn. And then for mga reconstructed breasts, of course, you will expect also a little asymmetry. Mga asymmetry, mga mas rigid siya, because of the subcutaneous fibrosis.
All right, thank you very much, Dr. Gigi Chua from Radiation Oncology.
Thank you for patiently waiting.
Better late than never. So we are so glad that we have closed the loop, so to speak, kay Dr. Arlene. We have closed the loop. So this is just a testament nga ang kaniintang pagtambal sa cancer multidisciplinary, dili ra usa ka doktor ang pinakamaayo ani. Although naagi mas gwapa sa uban. joke na sige mas gwapo sa uban, pero pareho ra gyud nga magtinabangay gyud ming tanan para maayo mo. Kung kaya pa namong ayohon o di man gani, we always hold your hand until the end of the journey. And naay question about nutrition. Ang kading nutrition, this cannot also cure cancer, ha? Namoy uban nga mag-vegetarian na lang kay para gyud. O karon na noon nagtinarong og nutrisyon, naay cancer, dapat unta sa una pa. So eat healthy. Ang basic ra gyud ana, ayaw og rely og supplements. Eat healthy. 5 servings of vegetables, more than fruits. Di pwede nga fruits ra kinahanglan kanang balanced diet. Di pud pwede nga di na lang gyud mag-carbohydrates, but just eat the proper amount. O kanang mga red meat, kanang mga processed food, as much as possible, you avoid them. Ang kanang mga meat, as much as possible, ang white meat over red meat. So we go on to the second panel for their last words. Lain mapaminaw ang last words. Oy, basta
Final words.
Grief and coping. Intimate words of wisdom from our second panel. So we'll start with Miss Elrica Paul, followed by Dr. Michelle Cabañesas and Dr. Francisca Batingan. And Dr. Francisca Batingan is available as well as Miss Elrica Paul.
So I guess my parting words with grief is it is okay to talk about grief. Let's normalize grief if it's a loss of a loved one or a loss of a body part, especially our breasts. And then it's not a linear process. It's not gonna be easy, but we will get through that roller coaster ride.
Thank you, Ika. My.
I guess ang grief, pace, your own pace. Do not be pressured no sa uban na okay si magsigig ingon okay ra na pero wala pa di ka na okay no, so get it on your own pace lang yun. That's all.
Francis?
Again, thank you for this invitation, Dr. Villegas. So basically, grieving is normal. Okay, so it's okay to cry, it's okay to be sad. Okay, because it's kind of coping also. But you have to be you have kinahanglan jud nga we have to recognize that for example, this is already an exaggerated grief already. Maybe this is already a pathologic or complicated grief. Please do not hesitate to contact us for a professional help. For example, the clinical psychologist, the psychiatrist, or us in palliative care. So we are here to help you, not just the physical symptoms, but also the psychological, the spiritual, and the social concerns. Okay, because we care for you. Thank you.
Thank you very much. Big hand to all our panelists and speakers. And do not log out yet, ha? Kay we have a very beautiful musical number, but of course, my gratitude won't be enough for our MC of the day and afternoon, Mr. Erwin Lim. So, back to you, Erwin.
Thank you so much, Dr. Emic Villegas. Of course, atong mga maanyag ug powerful kayo nga mga panelists and moderators. Dr. Jamie De Vera, Dr. Arlene Calaor, Dr. Aura Go, Dr. Michelle Cabanyesas, Dr. Francis Cabatingen, and of course, Miss Elrica po. Daghan kayong salamat kaninyong tanan. So, we've been doing this for almost every year since I started hosting the Cancer Chat here in Cebu. And gawin po natin to virtually sa mga nanonood dyan sa kanilang mga bahay. Itaas ang kanang kamay at ilagay sa ating dibdib at panoorin po natin ito.
May lunas ang breast cancer, lalo na kapag maagang nadiskubre sa pamamagitan ng sariling salat sa suso. Sinisimula nito pagtuntong sa edad 20. Ginagawa 1 linggo matapos ang regla o mens kung kailan ang suso ay hindi na masakit sa latin. Sa mga hindi na nagme-mens, regular ninyo itong gagawin sa parehong araw kada buwan. Ito ang 3 hakbang para sa sariling salat sa suso. Una, ang pagsusuri ng anyo o itsura ng suso. Humarap sa salamin. Ilagay ang mga kamay sa baywang at yumuko ng bahagyan. Pangalawang hakbang, hilahin pasulong ang mga balikat at siko at damhin ang paninikip ng muscle sa dibdib. Ngayon mo tingnan ang anumang pagbabago sa suso. Punahin po ang nipple ay pumaloob. Pagkatapos, pisilin ng bahagya ang utong o nipples at inspeksyonin kung may lumalabas. Pakiramdaman ngayon ang kilikili. Suriin ang kilikili habang nakaupo o nakatayo at ang iyong mga braso ay bahagyang nakataas para mas madali itong salatin. Mas mahirap ang pagsalat kung nakataas ng tuwid ang braso. Pangatlo sa inyong checklist, ang mismong pagkapa sa suso. Mahiga na ngayon ng lapat ang likod at nakataas ang kaliwang braso. Maglagay ng unan o tuwalyang nakabalunbon sa ilalim ng kaliwang balikat. Hindi ang dulo ng 3 gitnang daliri ang gagamitin sa pagsasalat, kundi ang pinakaumbok ng 3 gitnang daliring ito na kailangan ding siguraduhin laging magkadikit at palaging tuwid. Ilapat ang umbok ng mga daliri ng kanang kamay sa kaliwang suso. Salatin ang dibdib mula kilikili. Ulit-ulitin ito pataas at pababa hanggang masalat ang buong suso. Ngayon, salatin ang ilalim ng utong o nipple. Uliting muli ang mga hakbang ng pagkapa sa kanang suso gamit naman ang kaliwang kamay. May 3 uri ng diin ang pagkaba. Ang magaan ay para maramdaman ang tissue na pinakamalapit sa balat. Ang katamtamang diin ay para maabot ang mas malalim na parte ng dibdib at ang pinakamariin ay para makarating sa mismong dibdib at tissue hanggang buto-buto. Tandaang gamitin ang bawat uri ng diin isa-isa. Huwag iangat o alisin ang mga daliri sa mismong suso hanggang matapos ang pagsasalat ng kabuuan nito para makasigurong walang makaligtaang bahagi. Huwag magulat kung maraming masalat na maliliit na bukol. Kadalasan naman normal ang mga ito. Sa paglipas ng mga araw, punahin ang anumang pagbabago. Kung tumitigas ba ang maliit na bukol o lumalaki. Magpaturo sa doktor, nurse, midwife at barangay health worker para siguraduhin tama ang ginagawang pagsasalat. Hindi lahat ng bukol ay cancer. Kung may madiskubring pagbabago sa iyong suso, pumunta at kumonsulta agad sa iyong doktor. Nasa kamay mo ang kinabukasan.
Alright, so sana po naalala niyo yung mga tinuturo naming mga breast cancer exam and marami po kayong natutunan sa araw na ito sa mga discussions na ginawa natin kanina. So I guess at this point, katulad po ng na-mention ko po kanina sa opening part ng programa natin sa umagang ito, here we have now a pool of Cebuano, our international performing artists, traveled to 12 countries and perform at various esteemed international stages, bringing in the pride of our beloved country, the Philippines, and the province of Cebu. Join together to advocate Breast Cancer Awareness Month, MDF Royals. Please welcome Serge Michael, Ivy Galyur, Benji Layos, JJ Ang, and Gabriel Gomez. Let's give them a round of applause.
You may see a stranger, you may see a stranger across a crowded room. Then somehow you know even then, that somehow you'll see her again and again. Some enchanted evening, you may hear her laughing. Someone may be laughing across a crowded room. Night after night, strange as it seems, the sound of her laughter will ring in your
I have dreamed that your eyes are lovely. I
There you have it, the Dream Catcher. Super galing, super nakaka-proud. Ayan, marami po yan silang mga events na nangyayari sa Cebu. Kung gusto niyo po silang kunin sa mga events niyo, PM is the key. And now, mga ka-breast friends natin dyan, let's talk about mga good vibes talaga because we're bringing you now a story of hope. So here we go. Let's watch this.
One day more, another day, another destiny. This never-ending road to Calvary. This matter seems to know my time will surely come a second time. One day more. How can I live when we are parted? One day more, tomorrow you will surrender. And yet with you my world was started. One more day on my own, will we ever meet again? One more day with him not here. I was born to live again. What a life I might have known. And I swear I will be true. But he never saw me one more day before the storm. And the barricades of freedom. When our hands begin to roll, do I stay or do I stand? The time is now, the day is set. One more day to revolution. We will nip it in the bud. We'll be ready for these schoolboys. We will let them self-drink blood. There's a ring or a roll. There's a little tip. There's a little touch. Most of them are brothers, but they won't this far. What they do with you, you need a flag of freedom. Every man will be a king. Every man will be a king. What will be do you hear the people sing? My place is here. I'll fight with you. One day how can I live when we are parted? One day tomorrow is a judgment day. Tomorrow we'll discover what our God in heaven has in store. One more dawn, one more day, one day
Hello, everyone. It is an honor and privilege for me to share with you my cancer journey. I readily accepted May Ann's invitation to this one because ang ganda ng inyong theme, moving on and moving forward. And this is what my talk is all about. But first, I'd like to share a little of my own breast cancer journey. I had fibrocystic breasts and, I was diligent naman with the annual OB-GYN checkup as my family has history of cancer. It was in June 2005 when my doctor saw in the breast ultrasound and she also felt it during the clinical breast screening that there was this persistent breast lump that has become larger. Also, I compared to that one of the previous year. Also, the doctors have this certain feel. So as she said, why don't you check with the surgeon, which I did. The surgeon I went to recommended excision biopsy and other lab tests, which thereafter showed malignancy. In 2005, I was initially diagnosed with breast cancer stage 1. After discussions with family and the doctors, we considered considering the history of breast cancer and most cancers in our family, the decision was for me to undergo bilateral mastectomy. Most of you would think it was perhaps too aggressive. But like I said, breast cancer poses a threat to the women in my family. Of 5 sisters, 4 of us have breast cancer. Only 1 was spared. And so in July of 2005, I lost both breasts. And in December of that same year, all the spare parts down under. Because I started bleeding. So bilateral mastectomy and then total hysterectomy. I went through 3 major surgeries and countless other medical procedures in only a span of 6 months. 2005 was very tough. My thoughts then, there's this false sense of shame because for a woman to lose her breasts and all the spare parts down under, there's that thought of losing that you've lost your femininity. And then really physically, I just felt so mutilated and broken. For some time, I wasn't even able to bathe myself. I couldn't even touch myself. And so a younger sister who just happened to be, she was the headmaster of her school, but here she was ministering to me, bathing me, until one day, after a bath, I looked at myself in the mirror and smiled back at myself. You should be wondering why. Well, my body was smiling at me. The scars from the hysterectomy, I considered the eyes. From bilateral mastectomy were the eyes, and then yung scar from the, from the hysterectomy is the nose, and then, yung smile down under, yung V down under. That was, I think, the time when I fully understood and, it was just maybe the right time to accept that, hey, you are more than your breasts and you are more than all the reproductive organs down there. Anyway, by the middle of 2006, I was given a clean bill of health. So during the time, I tried to do all I can to have a relatively normal life, to pick myself up and then, get myself back together again. Sadly, though, by the end of that year, the cancer reared its ugly head again. At the time, I was experiencing unexplained bone pain, and that did not improve even after pain medication. So the bone pain also was accompanied by weight loss, decreased appetite, fatigue, the works. And the bone scan and the correlative tests showed that the cancer had moved to the bones, L4, L5. I thought this time I was really a gunner. My heart stopped a bit the first time I saw my oncologist, Dr. Felina Masadao de Fuin, write down the words breast cancer stage 4. After, that time that I kinda accepted already, here comes na naman a bummer. After, so I was required to do, I was prescribed to do 6 cycles, 6 chemocycles with Taxotere. And added to that was biphosphonate for the bones. And then after treatment of the bone mets in 2007, things were well, ganyan. But I had another scare again in 2010 when another lump grew in my armpit and my cancer markers were high. But thank God it only needed surgery and God's amazing grace to turn it around to normal. Yes, for the past years, everything as you see is normal, but I am always in terrible pain, and the usual cancer fatigue often feels double, sometimes triple, that there are times I could hardly get out of bed. There are days when my feeling would be, like, good Lord, take me na, ganyan. But there are times also, I become kind of mayabang, and then because, things are good, so confident yung posture ko na, oh Lord, bring it on. I can take it, yung mga ganyan. Most days, I live between the two. I have learned to live day to day, treat the pain when I need to, and rest if I want to. I was at a public consultation meeting a few days ago, public consultation for persons with disabilities. The people there thought I entered the wrong room. Why? Because I looked as healthy or a lot healthier than the next person on the street. But this is what breast cancer stage 4 looks like. I am still whole, but under this outfit are the scars from losing both breasts and all the spare parts down under. My bones are brittle and weak. A PET scan in 2019 showed stress fractures almost everywhere, and I have had to contend with a lesion in T9. Incidentally, I took out my brace today because I was wanting to feel more comfortable to be facing you and talking. It's been 17 years and counting. 15 years dealing with metastatic breast cancer. And again, I say, only by God's amazing grace. I am forever grateful to everyone who has been with me through the whole experience. It's not a walk in the park. I often complain and whine about some extra weight, aching joints, and then the many limitations for cancer survivors and patients. But friends, I consider I am doing just fine. Now, why did I say na napakaganda ng theme for this year, moving on and moving forward? A frequently asked question from new patients is is there life after a breast cancer diagnosis? You know, after enduring surgeries and treatments and all, and choosing to set aside, you know, the dream thoughts about dying and all, I tried to get my life back. This was during the period before the discovery of the bone mets and the Yan. Kung may kasama ka, things will get easier. That was then when I joined Minda's Body's Cancer Support Group here in my mountain city of Baguio. We would have the usual meetups, yung mga ganyan, coffee here, talk, share the cancer experience, and coupled always with the spiritual journey. No cancer journey is complete without a spiritual journey. You know, the sharings always spreads positivity, and then it really helps naman most patients and on active treatment, and then survivors too. It helps each one get through the struggle. However, you know, in my heart, I found there was still something lacking. As fate would have it, an active member of the support group which I belong to was invited to an activity in Manila, but she couldn't make it. God bless her soul. Myra Kagiwa, she passed away, but it wasn't from cancer, but from what you call this, she had a hypertensive attack, I believe. The dates for the seminar in Manila was in conflict with her schedule. So, I was so lucky. Indeed, it was a God incident. I think God put me there at the right time. And so I gladly attended the patient empowerment seminar, which was hosted by the I Can Serve Foundation and Avon Philippines. That was in September 2006. And the rest, as they say, is history. It was attending that seminar where I was initiated into a very special sorority, a sisterhood of breast cancer survivors. And that was where the first seeds of advocacy were planted in me. You know, it was there where I had that aha moment where I realized that, you know, the fight against breast cancer and other women's cancers happens not, you know, on many other battlegrounds, not only in the hospital. To save lives, we must educate women about the best ways to prevent and detect cancer early. And this is what the cancer chats that Cebu and so many other areas have been, putting up and fostering through the many years, diba? I vowed, like many of us who have been doing breast cancer awareness advocacy, I vowed I would do everything possible to help inform and educate the people here in my mountain city, kasi most are indigenous, and then, you know, there's wariness in going to the hospital, having themselves checked, even if they feel something, they don't really want to go. But, you know, our battle cry, one other battle cry of the cancer awareness advocacy is saying early detection is the best protection. And when earlier detected, it is easily cured, cheaper pa. So anyway, I was up until now, to me, my belief is doing this would help the women and men to make better choices and take preventive measures to avoid a diagnosis in the future. I emphasize men because I believe it was in Baguio City where we first were able to convince 2 male breast cancer patients and survivors to come out in the open and talk about their breast cancer diagnosis. That indeed there is a 1%, because we often say there's 1% of men who in the the landscape of breast cancers diagnosis, there are men too. And like I said, we've introduced 2 men. One sadly passed away, but the other one is thriving. He's already kind of old, over 80s na, pero buhay pa rin siya. He also had the mastectomy and all the works. So there. I also realized, na I have a mission to share my personal cancer experience, because a story of survival is also a story of hope. And sometimes hope is all that the person needs. We just had the Southeast Asia Breast Cancer Symposium in Manila. And we have this meme that one breast sister put out where she said, others would say breast cancer is a death sentence. But for us, the photo showed just how happy, giggly, and, nothing morbid or sordid about the looks on the faces of all these breast cancer survivors. So, there is hope. Anyway, in that seminar, in the patient empowerment seminar in 2006, there was this manual which was given, and then we were also, na-introduced din sa amin. It was introduced to us, the I Can Serve website. And in one of the articles I read, there was an article or something written by the I Can Serve Foundation founding president, Ms. Cara Alipala. In her cancer experience, she says that one significant learning is that the cancer survivor is one of the best kind of people she knows. Why kaya, di ba? You must be wondering why. She continues to say, when you face death, your life takes only 2 meanings, love and service. And you pursue it with tunnel vision. Every cancer survivor I meet is in a hurry to give back, what is called paying forward. She's thankful for being alive and for finally realizing the meaning of her life. All wounds and the scars these wounds leave turn into wisdom. As she goes through treatment, its harsh side effects, she always finds a way to serve. End of quote. I find that so very true. Because when I think of the late Noni Padilla Marsan, I fully understand what Cara meant with that. Noni organized and founded Minda's Bodies while battling breast cancer stage 4 then. She passed away on Mother's Day in 2004. But you know what? She used up her last 2 years for other patients as she visited and comforted cancer patients. She offered her shoulders for parents to cry on while their children were going through treatment, and likewise for parents who have lost their children to the disease. She helped raise funds for chemo and meds and whatever else, no? I used to read the local Baguio newspaper articles written about her, and I was in awe of her courage and her strength. I didn't know how sick she was, but she did not hold back and spent her last years in service for others. To this day, she is highly spoken about and remembered with much respect. And well, I told myself, I want to be remembered like that too. When I went back to Baguio after that seminar, I was beaming with passion and a vision for change. After a meeting where I re-echoed what I learned in the seminar, I was elected president of the group and have held that position since then. You know, many times, I would have wanted to give up the post. But, you know, they asked me to stay as president of the group for life. You know, that's a hard call. Being elected president for Minas Bodies started my work in the breast cancer advocacy. Yes, I chose to be an advocate. And although, you know, sometimes it's frustrating, I'd call Cara, I'd call Mayan and the other sisters, Melina and all. You know, I'd be calling them, ranting, and, you know, but they always say that it comes with the territory. Ultimately, I have come to believe and realize that advocacy is a truly noble calling because it enables me to help and serve others. I hope that my personal story illustrates why this is a path so worth pursuing. My work in advocacy includes organizing breast cancer awareness fora, arranging free breast ultrasounds, lab tests, and other such procedures with diagnostic clinics. I've partnered with surgeons for free clinical cancer screenings and on to no cash out surgical procedures in both the private and government hospitals. And I thank a good friend, Dr. Sherry Oncunanan, a breast surgeon here in Baguio, who, you know, I use and abuse my friendship with her because she also has her family has this foundation that has been helping with the free surgeries. Also, through the various I Can Serve seminars and advisories, I have learned how to navigate patients. That's how they say it pala. Navigate patients through the process. This would include helping a patient decide on the best treatment protocol, choosing a good medical team, introducing the patient to a survivor with the same profile, you know, age, things like that. Ethnicity sometimes also. In doing so, providing her a good companion through the cancer journey and, you know, nurturing friendships that will go beyond the 6 to 8 cycles. And then also, we have been helping to direct patients, even the survivors, we help direct them to agencies and offices for possible financial assistance when the need arises. And guess what? I even experienced situations where I become a wake or funeral coordinator. And sometimes we really even need to put together money so that we can give a decent burial for a fallen breast sister. I have not walked the advocacy path alone. I have been supported along the way by a very loving and enabling family who have allowed me to do what I do despite their worries and anxieties. about for my own health and well-being. Also, a caring circle of personal friends. The doctors and nurses from the Baguio Baguio and Benguet medical community. And well, I really have to emphasize the very generous partners and benefactors in the advocacy who have provided the funds for the various programs I have embarked on. Mindes Bodies doesn't have any money. It's not the foundation, and I kind of solely depend on personal donors. And then we are able to do, breast cancer awareness, shout outs or whatever it's called, because of friends in media. We also have developed a network of contacts and links from the cancer community. I thank my brothers and sisters from the faith community I belong to, Sacred Heart community here in Baguio, because I do the Martha, I do the work, and my gosh, their prayers are what I need so that we can successfully do our work. The dedicated members of Mindes Bodies, and again, I will be forever grateful to the dearest breast sisters from the I Can Serve Foundation, for whom I have the deepest respect and from whom I have derived the inspiration and the strength to face the challenges that come with volunteering and community service and perform better at each stage. Without everyone I mentioned, I would not have achieved much. To all these amazing people, like I said, I will be forever grateful. I received recognition for my work in the cancer advocacy here in Baguio. Those awards are an encouragement to work harder so that we can have empowered cancer survivors to connect to other women who have been recently diagnosed and help them to shake off the stigma of cancer diagnosis. We can have empowered patients who will take control of their medical care. And most importantly, we can achieve that goal of this decreasing cancer incidence in our city as we continue to pursue programs on women's cancer awareness and education. Prevent. It's always sad not to see that our roles are rising, our numbers are rising, I mean. But what I am really thankful for when it comes to the breast cancer awareness advocacy, yung early detection, even if the numbers may not be decreasing yet, but it is having patients diagnosed in the early stages. And so surviving is really on the rise naman. Hindi kagaya ng dati that stage 2, because of the lack of information, etc., would rather do some other treatment or would be scared about doing treatment because of the thought of how expensive it is going to be. Nothing like that. With all the programs and all the fora that we have been doing for the past many years, which is not only in October, we do it almost all year round. We always have something or the other. It's only in October when we really have a big bang. But yes, the numbers are not really going down. The thing is, survivorship is increasing. you know, the recognition has humbled me, and in the same breath has caused me to further reflect. In 2005, I was staring out at the world I knew through rose-colored glasses. I was happy. I felt healthy. I truly believed I had it all. Somewhere right smack in the middle of that charmed life, I was diagnosed with breast cancer. When you're first told you have cancer, your mind goes on overdrive. Will my life ever go back to normal? Will I die? Thankfully, prayer and unwavering faith carried me through. Family and friends also came together and helped me take both tiny steps and large strides toward recovery. New friends, whom I dearly call my breast sisters, came my way. That changed my entire perspective. They have inspired me by their stories of hope. And that is how I have learned to welcome cancer, to embrace it, and to learn to accept it. I know that they too consider that cancer, in a twisted sort of way, has been a great blessing. To me, it is and will always be part of who I am. Today, it still reminds me of my own mortality. On the other hand, it remains a gift that allows me fresh eyes to determine what is trivial and what really matters. Like I have mentioned earlier on, in 2006, a year after initial stage 1 diagnosis, my cancer was upgraded to stage 4. I thought I was a goner, and if you would have seen me then, you too would think that survival was slim to nil. Yet I am here before you today, a living proof that miracles can and do happen every day. My glasses aren't as rosy as those I wore some 17 years ago. They're crystal clear on some days, blurry on others. But there is also a pink tint on most days that reminds me there is more work to be done. A lot of women, some men, and more children to help. I like my new view. I really do. I hope my story will be testimony that sometimes small individual efforts can play an important role in the lives of other people and can make a dent in the landscape of the community. Back to the question, is there life after cancer diagnosis? And like the theme of this year's Cebu Pink Cancer Chat, moving on, moving forward, yes, there is life after breast cancer. Life after cancer diagnosis becomes a life of love and service. Thank you very much. I am Marivic Bugasto. God bless us all. To God be the glory.
Again, Ms. Marivic Bugaso, dagan kayong salamat for sharing and inspiring us with your story. God bless you po and amping always. And now, mga ka-breast friends, let's welcome my brother from another mother, the immediate past president of PSMO, Dr. Buenaventura Bill C. Ramos Jr.
Hi, everyone. Thank you for joining us today. Every year, we try our best to make it worth your time. So I hope you learned and enjoyed today's presentation. We are doing this to improve the lives of our cancer survivors, knowing that the journey isn't easy. We want to make the cancer experience a little lighter for the survivors, their families, and their loved ones. We want to educate the public on cancer prevention, detection, and treatment, from its basics to the updates. We want to promote health and well-being. This can be quite a task, but I know with the joined hands of the different societies and organizations, we achieve this little by little, one person at a time. And today, you are that person. So thank you for being here. Let us spread health and wellness by example. Maraming salamat sa inyong pagdalo at pagsama sa amin ngayong umaga. Daghang salamat kaninyong tanan.
Thank you, everyone.
Thank you. Dili nata live? Are we still live? And again, Philippine Society of Medical Oncology, the Medical Oncology Group Cebu, I Can Serve Foundation Incorporated Cebu, the Philippine College of Surgeons Manila, Philippine Society of General Surgeons Incorporated, PAPRAS, Philippine Society of Breast Surgeons, Philippine Radiation Oncology Society, Cebu Fuente Rotary Club, Rotary District 3860, BioOnco, Biomedis Incorporated. Daghang salamat for producing another fruitful Cebu Pink Cancer Chat this year. Daghan kayong salamat. See you uli next year, mga ka-breast friends. Stay safe, stay healthy, and let us all heal as one. Love, love, love.
Love, love, love. Thank you very much, Erwin. Thank you, everyone.
Thank you, Doc.
Thank you, thank you.
Thank you, everyone. Congrats.
Thank you,
Congrats.
everyone. Breast friend Erwin, thank you.
Ate Man, I love you.
I love you more. As always, next year ulit.
Puhon next year. Thank you, Kayo. PSMO, I Can Serve, love. Biomedis.
Doctors, thank you so much. I will make my essay. Biomedis, thank you. And all. Melay.
Miss Melay, salamat.
Thank you for your patience.
Sir Daltz, salamat. Ko lang nabasa, live pa.
Bluetooth disconnected.
Buhay sa payan.
Have a great day, everyone. Salamat. God bless.